Good morning. Welcome to the Interim Finance Committee meeting of January 17th. Couple items. I'm sorry, what did I say? January. Yeah, no. Just see if you're paying attention. We're in August. This is August 17th. Thank you. So there will be, just so that you know, there's going to be members attending in 3 different places. So we got the majority are here in Carson City. We have some in Las Vegas, and we also have some that are virtual. Let's start first with calling the meeting to order, and if we would take the, if Mr. Weber would please take the call the roll.
Assemblywoman Benitez Thompson. Here. Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Hanson for Assemblyman Levitt.
Here.
Assemblywoman Howdegi.
Here.
Assemblywoman Miller.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblywoman Peters. Assemblyman Roberts.
Here.
Assemblywoman Titus.
Here.
Assemblywoman Tolles.
Here.
Assemblyman Watts.
Here.
Assemblyman Yeager.
Here.
Vice Chair Carlton.
Very happy to be here.
Senator Canizaro.
Here.
Senator Dondero Loop.
I'm also happy to be here.
Senator Goycochea.
Here with bells.
Senator Hammond. Senator Harris.
Just here.
Senator Neal.
Here.
Senator Settlemeyer.
Here under protest.
Senator Tatro.
Here.
Chair Dennis.
I'm going to reserve my right to determine whether I'm happy to be here or not till when we get done, and then I'll tell you. Let me just double check one thing. If so many people in different places, I want to make sure I didn't miss anybody. Let the record reflect that those that are here, and Senator Hammond is absent, excused. Senator Sievers-Gansert is absent, excused. Who was? Oh no, I don't have to. Yeah. So sorry, we have an alternate there, and then Assemblyman Levitt. He has an alternate. Okay, so these are the two. Okay, so Senator Sievers-Gansert has Senator Settlemeyer as his alternate, and Assemblyman Levitt has Assemblywoman Hanson. Okay, which is, I just want to make sure I got that correct. Thank you for being able to step up. It's really hard. I know that we're all part-time legislators and have to take care of things, and sometimes people have changes, so I appreciate when you can get we can get the alternates and all that taken care of ahead of time. I know things happen sometimes, but do everything you can to, if you know you're not going to be available, to make sure to tell us with plenty of time. All right, let's see. Just a reminder, I know we get busy, but make sure that you turn off or mute your electronic devices. Reminding those that are connected virtually, if you'd keep yourself muted when not speaking, and keep your cameras on so accurate vote counts can be taken when we vote. Then finally reminding those participating virtually that the chat feature in Zoom should only be used to communicate technical difficulties with staff. So with that, before we go to public comment, I just want to take, I kind of did it at our last meeting, but we were virtual. Now that we're all here together, I just wanted to take an opportunity to welcome Ms. Amy Stevenson, who is the new fiscal person over at the governor's office. And she's coming to us from the Department of Veteran Services. And so unfortunate for them, but great for the governor's office and the rest of the state. And so we welcome you with us today. Thank you for being here. Great to see you. Just grateful people are willing to step up and help us help the state. So, All right, we're going to go to public comment. This is the first period for public comment on the agenda. There will also be another public comment period at the end of the meeting. Also note, because of time considerations, each commenter will be limited to not more than 2 minutes. Let me just emphasize that not more than. So if you could do it in less, that's great. Our last count, I think we have at least 48 people that want to give public comment. So if you can say "me too" as you go, that would be great also. Also, you can call in to provide public testimony during public comment period, the information for that is available online. It's also listed on today's agenda. Also, before we do that, just a reminder, when giving public comment, please don't attack our staff. Don't make it personal, because if you do, I will stop you, and so that we can move forward. And I don't anticipate that, but just because of, I know that sometimes people get very passionate. I want to make sure that we have a great meeting and that everybody has an opportunity to be heard. So with that, we're going to begin public comment. We're going to start here in Carson City. We have 4 seats here. So if you just want to come up and just continue to fill those up, we'll do public comment here for a bit, and then I don't know what we've got in Las Vegas and online, but let's get going, and then I'll figure that out as we go. So, and since you sat down first, I'm going to let you go while other people come up.
Thank you, Chair Dennis, and Vice Chair Carlton, and members of the Interim Finance Committee. It's good to be here in person today. Joanna Jacob, Government Affairs Manager for Clark County. And we're very happy to be here today in support of the items interspersed throughout Agenda Item F that are going to be devoted to children's behavioral health. This is really designed to work together as a system of care, and it represents an opportunity to do some critical investments for community-based care, and also to help the issues that we are seeing in Clark County with respect to availability for the beds at Oasis and Desert Willow. Those are behavioral health safety net beds. And we've heard from the state that it has been difficult for them to address some of the conditions in Clark County because of the increased need for staffing to address some of the needs that we have. So I really want to emphasize that I know the IFC is very aware of the issues that we have seen in Clark County that are impacting us, specifically with respect to conditions at our Child Haven facility, which is a 24-hour shelter that is always open without available community-based services or to have these safety net resources there. The impacts are held at Clark County. Our staff is impacted. More importantly, the kids we serve are impacted because they need often a higher-based, clinically appropriate setting. Since August 2020, what year are we in? 2021, we've had 96 children surrender to Clark County care just by their parents or guardians because they cannot access behavioral health services in the community. 45 of those 96 were just this year. That is something that we feel can be addressed by investing in community-based services that are meant to help those families ahead before they get to that point. And that is why we are in full support. We've been working for over a year in a working group with the members of the governor's office, state DHHS, Legal Aid of Southern Nevada and Clark County collaboratively on these issues, and so we urge your support. I also would like to say I
need you to wrap it up.
Yep. And so we urge your support. We're also here for the items on rental assistance and eviction diversion to help address questions. Thank you.
Thank you very much. Go ahead, and you can fill in the seats as they become available.
Thank you, Chair Dennis, Vice Chair, members of the committee. I'm Mark Kahn. I'm the Vice President for Health Affairs and Dean of the Kirk Kerkorian School of Medicine at UNLV, and I'm here to make public comment on item 12. The UNLV Kirk Kerkorian School of Medicine was established to care for the community, and we have a fragmented healthcare system in Las Vegas. We want to build a modern clinic that changes the paradigm for healthcare. Traditionally, if we can use a woman with breast cancer as an example, she might have to go to a surgeon's office and then later a medical oncologist's office and then a radiation oncologist's office. We want to provide a facility that provides one-stop care and equitable access. We won't turn anybody away for our entire community. We also importantly want to integrate not only physical health, but mental health in the same facility. Members of the committee, this is really important. It's critical for our mission to care for our community, and I thank you in advance for your support. I'd also like to express that part of this ask is also a laboratory facility, which will be discussed by one of my colleagues, and that's equally important to care for our community. Thank you.
Thank you very much. Let's go to the next one. Go ahead.
Good morning. Hello, Interim Finance Committee. My name is Michelle Bodenhorn. I am a parent of a child with Tourette's, sensory issues, autism, and other mental health needs. I support the investment of any funding that can go to the children's services and programs in our state. And I'd like to thank you in advance for your time and for investing everybody here in Nevada's children and families, because that's what we are here for. So thank you all for being here and doing this. Thank you.
Thank you very much. Let's go to the next caller, or next person.
Yes. Chairman Dennis, Vice Chair Carlton, members of the Interim Committee. Jason Mills, Vice President of the Nevada Justice Association. I'm here to support agenda item G12, which is the expansion of adding additional hearing officers and legal secretaries for the Nevada Hearings Division. These folks hear the workers' compensation claims here in Nevada, and I can report to you that due to the current backlog in the wake of the COVID pandemic, there's thousands of cases that have not been heard, that are waiting to be heard, and are not being heard in a timely fashion within the 30-day requirement as set forth by you all in the legislation in the law. By adding these additional staff members, it will reduce the loads that we believe that will help the injured workers get their hearings in a more timely fashion. So we encourage and support your financial backing of item G12, and I thank you for your time today.
Thank you very much. Good morning.
Good morning, Mr. Chairman, members of the committee. For the record, my name is Barbara Buckley. I'm the Executive Director of Legal Aid Center of Southern Nevada and a former colleague. I'm here today to just speak quickly in support of the children's mental health items listed in item F under the ARP requests. Our children's mental health system in the state has always been fragile. The pandemic shredded it. In Clark County, where I'm most familiar, you have kids with autism in Child Haven because there's not enough psychiatrists, therapists, professionals to do the testing, to get the diagnoses. At Grant-A-Gift Autism, the Ackerman Center, Medicaid will pay for the services. We have the services. We can't get the diagnoses. We have parents giving up their children because they can't get mental health services. We have kids trying to commit suicide next to kids with autism who are untreated, next to kids who are engaging in sex trafficking. The situation is as dire as I've ever seen it. Last year, we reached out to the governor's office and we said, we need a different approach. We're hemorrhaging. The governor's office pledged to support all efforts to improve our safety net. He mobilized the state of Nevada, Richard Whitley, his entire team, Clark County engaged, and through a lot of work, you see the items that came before you. We took the continuum from beginning in-home services to keep people out of the expensive residential treatment centers. We don't want kids to get to that level. Every step of the continuum, there's a request. We vetted it. We kicked the tires. The committee, met for over a year in preparing those. So with that overview, I urge your support.
Thank you, Ms. Buckley. I would be remiss if I did not, as I reflect upon my 18 years in this legislature, your mentorship as I came in and throughout those first few years. So thank you so much, and thank you for all the work that you guys are doing. Let's go to the next caller.
Good morning, Chair Dennis, Vice Chair Carlton, and members of the Interim Finance Committee. My name is Tyler Shaw with Ferrari Reader Public Affairs, representing Dignity Health St. Rose Dominican. On behalf of St. Rose's nonprofit acute care hospital system in Nevada, we would like to offer our support for several of today's ARPA work programs, including items 12 and 15, as well as their accompanying work programs, which represent a combined investment of over $171 million into Nevada's public health infrastructure. St. Rose is dedicated to making a positive impact on social determinants of health, particularly on the health of underserved populations in Nevada. These investments for our state will have a lasting impact on Nevada's public health infrastructure for years to come. Thank you for your time and for your consideration on these items.
Thank you. Go ahead.
Good morning, Chair and members of the committee. For the record, my name is Christine Saunders, and I'm the Policy Director with the Progressive Leadership Alliance of Nevada and a member of the Nevada Housing Justice Alliance. Today, you have a number of important investments in front of you, but I want to touch on items F55, 56, and 57 to continue funding rental assistance and eviction diversion in Clark County. The CHAPS program has been a lifeline for many Nevadans to maintain housing stability, and this funding will be able to help many families stay in their homes. But rental assistance alone will not solve our housing crisis, and tenants are looking to you to take action on real solutions to address rapidly rising rents and the summary eviction process. We hope that in the coming legislative session, these are things that we can work on together. Thank you.
Thank you very much. Let's go to the next person.
Thank you. Good morning, Chair Dennis, Vice Chair Carlton, and fellow committee members. My name for the record is Terry Laird, spelled Terrilaird. I'm the Executive Director for RPEN, the Retired Public Employees of Nevada. We're a dues-based, nonprofit, nonpartisan organization founded in 1976, and we currently have close to 8,000 members in 17 chapters statewide. I'm here today in support of Agenda Item G115, the transfer of over $1.2 million from the state's reserve category to the state Medicare retiree insurance cost category to cover a projected shortfall through the remainder of the year. PEB, the Public Employees Benefits Program, serves over 70,000 lives, and like many state agencies, is still suffering from the COVID-19 pandemic and budget cuts that resulted during the last session that brought the elimination of long-term disability as well as other budget impacts. As many legislators serving on this panel have read recently, PEB is not alone in suffering from staffing shortages, and all agencies as well as the public many of them serve are also suffering. You've no doubt read about DMV suspending walk-ins at all of their major facilities. There was also a news article this week about 40 vacancies at the Department of Employment Training and Rehabilitation, causing delays in service to folks there. RPEN works with a Public Employees Coalition during the legislative session, and we're hopeful next session of the legislature will be able to offer more relief to PEB and other state agencies needing financial assistance that the American Rescue Plan Act fund was unable to give. It's our hope that PEB can be restored to pre-COVID funding levels, and the state employees and retirees who benefit from it can count on those benefits when they need to. Good benefits impact the ability to recruit and retain good employees who at the same time need to offer good customer service back to the general public that they serve. Thank you.
Thank you. Let's go to the next caller, or next person.
My name is Mark Pandori. I'm the director of the Nevada State Public Health Laboratory. I'm speaking in reference to Agenda Item F, and that is support of a new state public health laboratory. It's a mark of wisdom and foresight that the leadership in Nevada is considered to invest so significantly into an institution such as a new state public health lab. The state lab is possibly the most important institution that people never hear of or think of. It's one of those institutions in the state that shows its success when something isn't happening, and that's namely illness and disease and death. The state public health lab finds toxins and bacteria in drinking and recreational waters and food. The state lab finds metabolic and genetic disorders in newborn babies, who we test every day in Nevada for 55 such disorders within 3 days of their birth, and that's every baby born in Nevada. The state public health lab finds tuberculosis, drug-resistant, and foodborne bacteria, and dozens of other infectious diseases in individuals that may or may not know that they have them. We detect and maintain the capability to detect chemical and biological agents of terror. The laboratory does all this for the entire state of Nevada. Our menu of capabilities is among the largest of all state labs in the United States, and our system of transportation and couriers gets any specimen from any part of our state to us within 1 day. During COVID-19, your state public health lab was one of the first 9 labs in the United States to be able to test for this virus, and since then we ran 475,000 such tests. You may or may not know any of this. Most citizens don't hear or think about this, and that means that the public health lab and the public health community is doing its intended function to keep these things away from people. But labs are like beings that must constantly be able to adapt and expand. The threats of the past are still here, and there's always new threats to come, particularly in infectious disease. We've seen this continuously in history, even our recent history, and even since COVID. The lab we have now cannot expand or adapt as it should face these challenges. Among these challenges also is opioid and drug testing. Nevada is now the only state in the United States without a state-level toxicological lab for this kind of testing.
I need you to wrap up.
Okay. Nevada's public health laboratory matters to the health of the people of Nevada. Nevada deserves to give that laboratory an ability to maintain that status and to grow to face future threats. Thank you.
Thank you very much. Let's go to the next person. Good morning.
Good morning. Good morning, Chair Dennis, Vice Chair Carlton, and members of the committee. My name is Maureen Schaefer, and I'm the CEO of the Nevada Health and Bioscience Corporation in Nevada, whose mission is to develop healthcare assets and education, clinical and research programming for Southern Nevada institutions. Our first project is nearly complete in delivering the Krikorian Medical Education Building for the Krikorian School of Medicine at UNLV. Built with generous state support, this building will serve to train and deliver more doctors to our state. Even before the onset of the pandemic, Nevada's tremendous growth and ambition revealed a need for increased healthcare services and infrastructure for our citizens and economy. The pandemic has placed even greater stress on this and in yet some ways opportunity on that reality. We are here today requesting funds to develop these critical and needed healthcare assets for the community. The first, a clinical and mental health care ambulatory care center for the Krikorian School of Medicine, mentioned earlier by the Dean of the Medical School, to further develop academic medicine for Southern Nevada community. And secondly, a public health laboratory to deliver enhanced lab services to our Southern Nevada population in a more cost-efficient and timely efficient manner. Our organization, the Nevada Health and Bioscience Corporation, develops and delivers healthcare assets to our population. We will work with anyone to advance increased quality and innovative healthcare as a public good for all citizens in Nevada. We look forward to speaking with you further about the opportunity to be part of these important requests today. Thank you so much.
Thank you very much. Go ahead.
Hello, for the record, my name is Matthew Hahn. I'm the president of the Graduate Student Association at the University of Nevada, Reno. The Graduate Student Association represents about 3,700 graduate students at the University of Nevada, Reno. However, when I'm not acting as the president of the GSA, I am a student who is working on my PhD in physiology and pharmacology at the School of Medicine, where we provide research not just for the community, but for a worldwide audience. Today I'm here in support of Agenda Item F, Workforce Development Program number 12, which helps to provide an investment into the Nevada State Health Laboratory as well as the School of Public Health. The reason that these two investments are important in relation to graduate education and undergraduate education is that they're able to provide a resource for individuals at the university to partner with individuals at the Nevada State Health Lab. To put this in perspective, during the COVID-19 pandemic, over the last 2 years, what the University of Nevada researchers were able to do is they were able to carry out genomic sequencing from real patients in the state of Nevada, in northern Nevada and southern Nevada, to find that there were slight variations between the differences in northern Nevada compared to southern Nevada. Not only did this provide information on our community and enhance education of graduate students and undergraduate students locally, but it was able to provide timely information to the state, and not just the state, but it was able to receive renowned national recognition for sequencing the COVID-19 virus and provide accurate information about single genomic mutations that were occurring in real time. As a result, this partnership between the university and the state public health allows for research that is able to be carried out on a timely basis as well as a relevant basis in terms of what is going on in our society globally and for the state of Nevada. Along with this, research at the University of Nevada has provided about $300 million in revenue and would continue to do that with your added support through these two initiatives. Thank you for your time, and thank you for allowing me to speak today.
Thank you very much. Go ahead.
Good morning. My name is Fatima Azmi, for the record, Fatima-Azmee. I'm a master's student and an elected representative with the Graduate Student Association from the College of Liberal Arts and Reynolds School of Journalism, as well as the internal vice president of the GSA, which, as you've heard, represents over 3,700 graduate students. I came here today to support Agenda Item F, Program 12, for expanding the capacity and infrastructure of Nevada's public health system through the support of the UNR School of Public Health and to expand the Nevada State Public Health Laboratory. The School of Public Health works closely with the UNR Student Health Center on campus, and because of their cooperative relationship and their closeness and proximity, the Student Health Center and the Nevada State Lab were able to provide valuable resources to both our graduate students and undergrad students populations during the COVID-19 pandemic. The Health Center is able to provide treatment and diagnosis to little to no cost for most common health concerns, or they help students attain the resources they need for more serious concerns. During the last few years, the partnership between the Student Health Center and the Nevada State Lab were able to provide an easy, quick, and safe way for our students to get tested for COVID-19 viruses, myself included. As earlier this year, I had the virus, and without the lab, it would have been very difficult for me to get tested and then keep my family safe, as well as the students that I teach in my lectures. But by providing funds to the Nevada State Lab and the School of Public Health, these partnerships will be strengthened and will help support the close to 20,000 students at the university. Thank you so much for your time and consideration.
Thank you very much. Go ahead.
Hello, my name is Scott Dooley, and I am an elected council member for the College of Engineering graduate program of the University of Nevada, Reno. I'm here to say that I support the Agenda Item F, Work Program 12, for the transfer of $151 million to expand the capacity and infrastructure of Nevada's public health system through the support of the UNR School of Public Health and to expand the Nevada State Public Health Laboratory. Looking deeper into the UNR School of Public Health, I keep running into the mission statement to develop, disseminate, and apply knowledge to protect and promote the health and well-being of individuals, families, and communities. This goes to say that UNR is more than just the students, faculty, and encompassing workers. The ranking of Tier 1 as research is a huge award that proves UNR helps more than just the local community. In reason, UNR helps people at levels of state and nation. This is due to the level of projects and research coming out that helps to aid current known problems, especially from the School of Public Health. As part of the agenda, justification paragraph 2, $3 million will go towards renovations, recovery, and preparations in synopsis. Furthermore, this will help to aid from COVID-19 effects and help to mitigate future public health emergencies. COVID, as you know, made a huge impact on the community, and preparing for future is an absolute need. That being said, by aiding in the future development of the UNR School of Public Health and as well as the Nevada State Public Health Laboratory, future development is being put forward to put the great people of the nation in a good position. Thank you so much for your time.
Thank you very much. Go ahead.
Good morning. My name is Monica Bharti. For the record, MONIKA-BHARTI. And I'm a PhD student and an elected representative of Graduate Student Association from College of Education and Human Development. I support agenda item number F, work program 12 for the transfer of $151 million to expand the capacity and infrastructure of Nevada's public health system through the support of the UNR School of Public Health and to expand the Nevada State Public Health Laboratory. I support the initiative. In my opinion, the public health is very much related to the infrastructure. So for example, it can help generating more public health professionals. Investment in public health programs saves money by preventing injuries and illness, which is particularly important as the population ages. In the city of Reno, at the popular areas like university and airport, there is likelihood of more transmission of pathogens and transmission of coronavirus. So Student Health Center, in association with a Nevada State Public Health Lab, was able to offer frequent testing. As a result, students were able to know on time what precautions they have to take in order to prevent the spread, which in turn helped us a lot, whole university a lot. So I think this initiative is required and will support us a lot. So thank you so much for legislatures for listening my comment, and thanks for having me.
Thank you very much. Go ahead.
Good morning, Chair Dennis, Vice Chair Carlton, members of the committee. Rob Benner with the Northern Nevada Building Trades. We are here also to speak on item F12, the $150 million for the health lab, Nevada Health Lab at UNR. As some of the members of the committee know, our relationship with UNR, the building trades and UNR, has been rough over the years. That has changed quite a bit in recent years. UNR has worked very closely with us on this project and has committed to a project labor agreement, to negotiate a project labor agreement if this project is funded. This will ensure that the local workers in Northern Nevada will be put to work on this project. I think going forward in the next couple of years with a little bit of economic uncertainty, we need to make sure that we have projects like this in the pipeline that have labor requirements on them to make sure that if something does happen, our local construction workers will have jobs that will put food on the tables of their families. I think that's really important. I know in the past, in the last recession, I was one that was out of work for a while, and going around and looking at construction projects that were going at the time with out-of-state contractors and out-of-state workers hurt a little bit. But UNR is ensuring that won't happen. This project will be built with local construction workers. Thank you.
Thank you very much. Go ahead.
Good morning, Chair Dennis, Vice Chair Carlton, and members of the committee. My name is Megan Kamlasi, and I am the Associate Director of the Center for Public Health Excellence within the School of Public Health at UNR. As you consider the proposed investment in public health infrastructure today, I think it's important to understand what public health is and why robust infrastructure is critical for the state's public health system and the health of Nevadans. Prior to the COVID-19 pandemic, many may not have been aware of ongoing public health efforts, and that's generally because public health activities happen in the background. They're invisible when they're working, and regardless of whether we realize it or not, they have an impact on our daily lives. In contrast to doctors who diagnose and treat individuals and their illnesses and injuries, public health experts diagnose and treat the health of entire communities. They listen to community members, use data and evidence to offer solutions, and then work with community partners to implement them. Governments have been taking steps to keep people healthy for the last 150 years, and these efforts have evolved with scientific advancements, from developing basic sanitation practices to embracing water purification, sewage treatment, and immunizations, to ensuring food safety and working to prevent and manage chronic diseases like cancer and heart disease. We often take these achievements for granted because, at least until recently, devastating pandemics had been a thing of the past. But for many, COVID-19 provided the first concrete example of what the public health sector does and underscored the importance of robust public health systems. It also highlighted the consequences of decades of chronic underfunding, workforce shortages, and outdated infrastructure, which limited the state's capacity to respond to public health challenges prior to the pandemic and exacerbated them during the crisis. This one-time investment that you're considering today in Nevada's public health system, the largest in the state's history, will help the agencies, labs, and schools of public health at UNR and UNLV who work closely together to comprise the public health system in Nevada to regain their footing and ensure they're better prepared to successfully respond to current and future public health needs. Thank you.
Thank you very much. Go ahead.
Chair Dennis and member of the committees, thank you very much for your consideration today to provide funding for this UNR School of Public Health this morning. My name is Müge Akpınar Elçi. I'm the Dean of the School of Public Health at UNR. Our school is a critical piece of the public health system in the state. It is a key component of the state public health workforce pipeline, training many of dedicated public health servants who worked tirelessly during the COVID-19 pandemic and who will continue keeping our communities safe and healthy after the pandemic. This fall, we will have 1,500 undergraduate students and around 300 graduate students. And we are very proud that 80% of our graduates stay in the state. Our research-driven faculty are highly involved with the Nevada public health practice and the policymaking. During the pandemic, our school and our centers played an important role in the state's pandemic response, hiring, training, and managing more than 100 contact tracers. We did also train the testing site staffers, epidemiologists, and biostatisticians for local public health authorities. They develop essential COVID-19 training, webinars, certification, and also we help the vaccine clinics for underserved communities. We have grown to one of the largest schools at the UNR. We have very limited space. Our students and staff are scattered around 5 buildings on the campus. This proposed $3 million to renovate a building for School of Public Health will provide additional space and also bring us together in the same physical environment. It will help us increase the capacity to train more public health practitioners and enhance community engagement as we continue working closely with state and local public health agencies and UNLV School of Public Health to keep Nevadans healthy. Thank you very much.
Thank you very much. Go ahead.
Chair Dennis and members of the IFC committee, or IFC. Ben Challoner, Policy and Legislative Director for Lieutenant Governor Lisa Cano-Burkhead. I'll be brief and will submit full written comments. But the Lieutenant Governor is in support of various items before you, specifically the children's mental health as well as the community college aspect. As a former educator and school administrator, Lieutenant Governor Cano-Burkhead understand what these investments will mean for our youth. As a high school principal, she saw firsthand the toll that the pandemic took on her students. There are many additional factors that contribute to a child's mental health. These investments will make sure that we as a state are meeting those needs. Additionally, the Lieutenant Governor is a strong supporter for any and all higher education. That includes 4-year degrees, community colleges, and trade schools. These community college investments will allow for students to gain that education without incurring any debt. Thank you.
Thank you very much. And as another privilege of the chair, I wanted to thank Mr. Chancellor. He was my assistant when I was in the earlier in my Senate career, so I appreciate all the work that he did there and to help make me be better. So thank you. All right, I'm not seeing any. Is anyone else wanting to give comment here in Carson City? Okay, we're going to go to Las Vegas. Anyone? And I'll ask my folks down in Las Vegas, my colleagues. Is there anyone in Las Vegas coming up?
Chair Dennis, this is Assemblyman Yeager. We do have a couple folks at the table, and I think there are others who'd like to give public comment as well. So we have quite a few down here.
Okay, so what I'll say what I did before. Fill those 2 seats, and as someone sits down, just go ahead and fill in, and then we'll just keep going as we do that. Okay, so let's see. Why don't we start? Since I'm on my left, which would be the person on the right. Yes.
Me, right.
Yes. Go ahead.
Good morning, Chair Dennis, Vice Chair and members of the IFC. I am Melissa Saragosa. I am the Chief Judge of the Las Vegas Justice Court. which handles about 70% of the entire state's summary eviction proceedings. And I am here today to speak in support of item F57. Specifically with respect to eviction diversion. One of the things that we have learned or a positive outcome of the COVID pandemic was that we forged a great partnership with the Clark County Social Services, and we are working together in eviction diversion. That is a really important aspect of, I think, what the county can offer to individuals, what the court can partner with them to remove those cases which can prevent evictions out of the court system. To give you an idea of what we're seeing and some new recent numbers, in a typical year, the court, Las Vegas's Justice Court, sees about 30,000 evictions a year. In fiscal year 2022, we opened 43,902 eviction cases. Now, those are opened by either a landlord or a tenant, depending upon the filings. And with that volume and our limited resources, right now, a case that opened today that needed to be set for hearing wouldn't get set until January of 2023. It's a very long period of time, which on one end gives us time to provide resources through a diversion program to individuals to prevent eviction, but it also will help us bring those cases out of the court system, take those cases off of the court's calendar. It is very, very busy. Part of the reason I want to offer that we see so many cases or saw so many last year is because when someone has been given rental assistance and then falls behind again, they file again. So what we're seeing as a result of the way the system is working, someone will file rental assistance, that case is stayed. When it's approved, that case is dismissed. When they fall behind again, there's a new case that's generated. So although the number looks large, it's processing that same case over and over again, and we think we need to do something better. So that is the intent of the diversion program that the court is now working to develop and working with the county on. So we are in support of additional funding to support eviction diversion and dollars that would be used, flexible dollars, because there are a variety of reasons that someone may come into the system and need rental assistance that are unrelated to COVID. So the ability to be able to use those dollars for the county to use those to prevent an eviction is really critical. Thank you for your time, and I appreciate being heard today.
Thank you very much. Let's go to the next person there in Las Vegas.
Thank you, Mr. Chair, members of the committee. My name is Dan Musgrove, and I am a lobbyist by day who represents a few clients that are in the space of children's mental health and mental health. But today I'm here first as a Nevadan, as well as a past chair of the Clark County Children's Mental Health Consortium. I'd like to call your attention to a letter that our chair, Amanda Habush-Deloy, provided. But I think it's important that I echo the comments of Speaker Buckley, Joanna Jacob with Clark County. What you're seeing before you on item F is essentially 30 items, roughly, that are focused on children's mental health that are generationally transformational for Nevada and our system of care for children. I can't tell you how important the work that the core group that Speaker Buckley referenced that's been working on this for over a year. I had the honor of being a part of that group that met every week and sometimes more than that to talk about these items and work through this process. And we would not be here, obviously, without our federal delegation giving us these funds, but the work of the governor, specifically Bailey Bortle and Director Whitley and his team at HHS and Dr. Cindy Pitlock and all of her team at DCFS and the incredible folks at Clark County who have been dealing with the issues at Child Haven and other, it's just been tragic as to what our children and our families have experienced. The consortium has been very involved in this for a number of years. I was chair for 8, and we've come to before this legislature for a number of years asking for these kinds of support and services. And this legislature has an amazing opportunity today, and we cannot thank all of those who put in the work enough, because this, as I said, is huge for families and children. And so Once we get this today, our work begins on making sure that those funds can be sustainable, that we can find the providers, that we can put these programs into place and make sure that they don't go away. But we would not be anywhere near this without the work of all of those advocates and people who do this on a daily basis. So we ask humbly for your support, and thank you very much.
Thank you. Let's go to the next caller.
Good morning, Chair Dennis and members of the committee. My name is Dr. Michelle Paul. I am the Executive Director of UNLV Practice, a university-based interdisciplinary community mental health training clinic. I'm joined today, my Me Too is behind me, my colleague, Dr. Sarah Hunt, who is the Director of the UNLV Mental and Behavioral Health Training Coalition. Together, we represent mental health training at UNLV, from the classrooms to the clinics and on to the community. We know that it comes as no surprise that Nevada faces a mental health crisis, ranking last in the nation for access to care despite the great need, according to Mental Health America. We thank you today for your consideration of agenda item F12, which expands the capacity and infrastructure of Nevada's public health system. More specifically, the proposed UNLV Academic Health and Ambulatory Care Center is an important and necessary initiative to increase much-needed access to quality mental health care while developing the next generation of mental health workforce. We're excited about the proposed ambulatory care center, as it will co-locate and integrate UNLV's 2 community mental health training clinics that are currently operating independently of each other. Every year across these 2 clinics, approximately 60 mental health masters and doctoral students provide an estimated 15,000 hours of low-cost sliding scale services to children, adolescents, and adults from the community under the expert supervision of properly licensed or credentialed faculty. Additionally, this type of innovative clinical space will promote and expand whole person care by allowing our student therapists the opportunity to integrate and train in medical clinics, thereby expanding access to desperately needed mental health care. And we're most pleased to tell you that there is a committed team behind this building working together to ensure that mental health is viewed as equal to physical health and guided by the principle that the community grows healthier when we integrate the 2. We look forward to answering any questions that you may have about the mental health services and training in this proposed space, and thank you for your consideration of this space where we hope to grow, innovate, and make a difference for Nevada. Thank you.
Thank you very much. Let's go to the next person.
Good morning, Chair and distinguished committee members. My name is Kendra Gibson. I'm the Family Voice Facilitator at the Statewide Family Network Program at Nevada PEP. Nevada is designated by the Substance Abuse Mental Health Services Administration, or SAMHSA, as the statewide family network for our state and as the parent partner organization for the state system of care grant, which are both focused on improvement of systems that serve families and of children with behavioral health care needs. Unfortunately, before the pandemic, Nevada struggled to meet the behavioral health care needs of children, youth, and their families, ranking 51st in the nation of children's mental health. The pandemic only added to the pre-existing challenges youth have faced, including grief, loss, and the fear of the unknown, which has resulted in more children and youth experiencing depression, anxiety, and trauma. Children and youth with identified needs prior to the pandemic, such as those with emotional disturbances, ADHD, autism, and intellectual and developmental disabilities, were disproportionately represented and impacted by the pandemic as they regressed in their social, emotional, and academic skills. Our systems in Nevada are now struggling to be responsive to the immediate and significant needs of our children and families. Staffing shortages in our schools, mental health, and other community systems are further impeding Nevada's recovery. This investment in children's behavioral health care is a critical need for Nevada's children, youth, and their families. Without access to family supports and effective, equitable, community-based services, more Nevada children will have poor outcomes and be at an increased risk for out-of-home placements and institutionalization. Thank you for supporting the system of care's capacity to serve the most vulnerable children and their families in Nevada. Thank you.
Thank you. Let's go to the next caller. Next person.
Chair Dennis, committee members, Yesenia Gonzalez for the record. I'm here in support for item 25. I come in support for the Grant a Gift Autism Foundation Ackerman Center, as does Azul Blue United by Autism, as they are a fundamental stepping stone in our community for many families. However, many families contact us asking for help because of the unfortunate long waiting list. The Ackerman Center has early intervention, as many know, early intervention is key. And we are seeing the rates of children being diagnosed with autism rising. Dr. Gaspar and Dr. Beasley are vital in our community, and I come to you all. I ask you, as a mother of a child on a waiting list with autism, a mother who has autism, who is advocating for her community, to please help the Grant a Gift Autism Foundation Ackerman Center and those families on those waiting lists, because no child should be left behind. And I do apologize because I do have a speech impediment, but it is very disheartening when we keep receiving these calls. We have parent guides where we give these families these informations on where they can turn to, where they can get help, but we cannot guide them to the right place, because I have been on a waiting list for over 3 years now. And as much as we are patients with Dr. Gaspar, with Dr. Beasley, she's someone who we really, really need help with. So if it's happening to me, I mean, we hear from families what is happening, and this would be vital in our community. And I'm asking you, please, as a mother, as a member, please help our community. Please help them to get this grant. Thank you.
Thank you. Thank you very much. Next person, please.
Good morning, Chair, members of the Interim Finance Committee. My name is Magdalena Ruiz. I am the Family to Family Peer Support Services Program Director at Nevada PEP. We know that families play a critical role in supporting their children's education and well-being. And we know that families continue to need support because of the damaging effects the pandemic has had on children's mental health. The current shortage of educators, mental health, and community providers make it even more difficult for families to navigate the service systems for their children. Family peer support services is important to help families meet the behavioral health needs of their children. Each month, we support 700 families of children with autism, emotional disturbance, ADHD, intellectual and developmental disabilities who also have behavioral health care needs. Family peer support services are a part of a nationally promoted comprehensive children's system of care. Nevada PEP has provided the service statewide for over 25 years in partnership with DCFS. Our program follows national best practice standards, and our providers complete a 2-year training and national certification process. We use our own lived experience and expertise of having a child with similar needs to provide encouragement, connection, mentoring, and skill building to help families obtain the support and services they need and their children need. Thank you for supporting Nevada's children, youth, and families who are most impacted by the pandemic. Thank you.
Thank you very much. Let's go to the next person.
Ma'am, would you make sure your microphone's on?
Yes, I can hear you. Go ahead.
Thank you. My name is Krista Cielo. I'm a parent of a 19-year-old on the autism spectrum, also having ADHD and bipolar. I fully support your investment in the children's mental health care in Nevada. We recently went through 18 years of trying to navigate the Las Vegas Children's Mental Health Care Services. And let me tell you, it was always a fiasco and a full-time job. The waiting list was either ridiculously long, providers were subpar, or many times there were simply no providers for the services he needed in the entire Clark County, or sometimes even in the entire state of Nevada. Please dedicate as much funds as possible to the Children's Mental Health Care Services and to autism services, so that the children that are coming up today will not have to go through what my son and I had to go through. Thank you.
Thank you. Go ahead.
Greetings, Nevada's IFC and everyone represented today. For the record, my name is Norma Iris Medina, and I'm a parent of 10 children, and 4 of them suffer mental illness. 2 of them have ADHD they were diagnosed with today and with sensory challenges. And so I also have 2 daughters who have greatly suffered with anxieties, and especially after the pandemic. So I'm here because I wanted to express how the lack of treatment options creates issues for us parents and the communities in which we live in, and yet we have not to this day been able to receive treatment for 3 of my kids because of the shortage of the mental health services, and more specifically in the area of therapy. We're still on the waiting list. Also, another concern, as a mom, we have seen an increase in suicide. It has been an unfortunate issue for us families in Nevada, especially for the youth, because it affects everyone. Suicide, as we all know, is a leading cause of death for the Nevadans between the ages of 12 to 19, according to the Nevada Suicide Prevention. So last year, my children had to witness their peers being depressed, angry, ongoing fights, and sadly receiving the horrific news about their peers committing suicide. And then we have to, go through that process with them. So the impact of loss has caused my kids many of a great deal of emotional pain. And then they're still experiencing and have experienced such great loss with not having to be able to go to the certain things of the school and stuff like that. So trying to deal with that and navigate through those things for those milestones. So yes, I am here to support in the proposals for the mental health services, because as we know, it's impacting our own family and other families. And so I'm here because if I want it to be known that if it goes untreated, there's an increase of risk of school failure, also contact with crime, with the criminal justice, dependence on social services, and even higher rates of suicide and addictions and so many other things. And as a mom, I'm trying to be proactive, and I want not only save my kids' life, but other children, right? And so I just here because I want my voice to be heard, and I want to see families having access to mental health services for all children of all ages. So yes, I do support the proposals for the mental health services. I thank you so much for your consideration and time. Thank you.
Thank you. All right, let's go to the next person.
Good morning. For the record, my name is Sean Gerstenberger. I am the Dean of the UNLV School of Public Health, and I'm here to express my support for item F12 on the agenda. In the essence of time, I'm not going to reiterate all the support expressed by our colleagues in the North for the laboratories and other areas, but I do support them, and we need that infrastructure across the state. I do want to specifically take a minute to talk about what that funding would be used for at UNLV. That funding for the School of Public Health would go to support and enhance the work of the Nevada Minority Health and Equity Coalition. That coalition is really designed to look at and reduce health disparities and increase health equity across the state. We're not going to make our state healthier by working with all of the healthy people. Unfortunately, we have to look at those people who are the sickest, and often they're marginalized for minority groups, disenfranchised, underinsured, and low-income individuals. That is exactly what this group does. does. The coalition has over 350 members, and this would provide a space for those members to work with UNLV, with our faculty and staff, with our students, provide culturally competent training to infuse the workforce with students who can address these issues, and work together, as we have demonstrated we can already do, to bring additional federal funding into the state to address issues like COVID, mental health, and many other things that were exacerbated by the COVID-19 pandemic. So I do want to thank you for your time today and listening to me, and I do support all of the other items in F12, but I'm not going to reiterate them for you. So thank you for this opportunity today.
Thank you very much. Let's go to the next person.
Good morning. For the record, my name is Stephanie Moore. I am the Outreach Director for United Citizens Foundation, a nonprofit organization that provides mental health services to our community. Dear members of the committee, I am not here to rattle off statistics regarding mental health or the amazing work that our organization does, as I am sure that you all have access to that information should you seek it out. I am here to share a personal story with you that I hope will allow you to see the need for mental health care in our state. 12 years ago, I was a senior in high school, and I sat next to a young man named Adam in my math class. Adam was an incredibly smart, kind individual. We often spoke to each other about what we would do once we graduated. We would talk about which colleges we were going to go to and what professions we were going to go into after college. One day, Adam did not show up to class. And the next day, my class, along with a few other classes, were taken into the auditorium. And we were told that Adam had passed away and that he had committed suicide. I wonder often about that day. We had no idea that Adam was suffering. It is not something that he had ever shared with us. But I do wonder if there was a system in place that could have provided Adam with that support, if he had had a place to go to talk through his issues, he could still be here with us today. And I believe that if we put more funding into mental health services, that there are so many other people, such as Adam, that could be saved and could still be with us today. Thank you.
Thank you. Let's go to the next person.
Good morning, Chair Dennis, Vice Chair Carlson, and the committee. My name is Michelle Johnson, and I'm also with the United Citizens Foundation, a nonprofit 501c3 agency established in 2010 and dedicated to serving children, youth, families, and individuals by providing mental and behavioral health and substance use counseling. Our mission is to provide services and programs for underprivileged, underserved, and at-risk youth and families. This is done through our school-based health clinics, home-based services, telehealth, and through our 2 community-based clinics. UCF has identified a problem relating to the lack of access to essential mental health services for youth and their family in Nevada. Through our school-based health clinics, UCF provides services at 15 Clark County High School District, at 15 Clark County schools. And we're ensuring students and families, regardless of their economic status, receive mental, behavioral, and substance use counseling services. Our clinical and support staff includes licensed clinical mental health professionals, school and community liaisons, and community health workers. Amongst youth, serious behavioral and mental health problems such as self-injurious behaviors, suicidal ideation, domestic violence, sexual assault, abuse, difficulty adjusting to peer relational issues such as bullying or alcohol and substance abuse are assessed, evaluated, and treated by licensed staff. Our goal is to ensure that youth have access to much-needed supported services to improve student performance and behavior in schools, as well as to proactively avoid incarceration, victimization, homelessness, and/or alcohol and substance abuse addiction. I thank you for your time.
Thank you very much. Let's go to the next person.
Good morning. Thank you, Chair Brooks and committee members, for your service to Nevada. My name is Yvette Williams, and I'm chair of the Clark County Black Caucus. And I'm here today to speak with you regarding an issue that is a priority to the Clark County Black Caucus, given the disparity in accessing health care for African Americans. It is no surprise to this committee that access to mental health professionals is critical, and currently Nevada students are in crisis. During last year's African American Student Summit, an astonishing 98% of all students in attendance expressed that either themselves or someone they knew needed mental health support. You've heard comments about the reality of capacity and the inability to meet the needs locally. 30,000 plus students that sought help in Nevada and are insured have a copay that often parents cannot afford to pay, especially when their child needs more than one session. This can mean thousands of dollars for many families that can't afford it, leaving them feeling helpless and desperate to help their child. And that is only if they are one of the lucky few to find a mental health professional. You've heard some of those stories today. I can tell you I've personally received these desperate calls to my dismay from parents and sometimes students. We support funding more mental health support for our students and through school-based providers. We have advocated before the legislature for more resources for the past 6 years. Let me share one of those impactful providers seeing amazing results. We were very pleased to collaborate with Clark County School District in addressing this crisis head-on and gaining support from the School Board of Trustees to provide thousands of students mental health services through telehealth at school and home. Keeping students in school. Since January of this year, through Hazel Health LLC, CCSD provides access to mental health professionals to every student in CCSD without any out-of-pocket expense, regardless of insurance status, reducing the access gap. Students are seeing a professional within 2 weeks and are referred to a local professional for any necessary follow-up after 6 weeks of therapy of care if necessary. All students have access, including undocumented students and those whose parents make too much money for Medicaid and too little to purchase private insurance. 30% of these professionals are people of color and speak over 20 different languages, aligning cultural competency. Let me make it clear that telehealth does not replace the need for local services. It's just to help with the capacity challenges that we will never be able to achieve. I've attached more information about this program and its benefits to this letter with copies for each of you. I also sent it via email to your committee secretary for further review. What you have before you is just a handout. That is the flyer that's given to every student with the QR code where the parent can give authorization. I'm available to answer any questions you may have. We are asking that this program and programs like this continue following ARP funding. Okay, we can't imagine that students won't have mental health access they need after the 2024 school year, and humbly request that dollars be allocated for the 24-25 school year, this next millennial budget. This cost is $15 per year per child. $15 per year per child. We are also asking that this program be expanded to include all students in Nevada, including Northern Nevada and the rurals. Thank you so much for your time.
Thank you. Let's go to the next caller.
Good morning, Mr. Chair, members of the committee. My name is Virginia Valentine, and I'm representing the Nevada Resort Association. I'm here today to ask your support on item F16, which includes a grant to the Southern Nevada Health District for staffing. As you know, the Environmental Health Division oversees public health in restaurants, tattoo parlors, child care facility, a number of other things. And they are very important, of course, to community well-being. So we'd like to support that. We want to thank the Office of the Governor for having this on the list. We think this is really important to support their staffing as we continue to recover and deal with some critical labor shortages and also the impacts of inflation on business. So again, thank you for your time this morning, and we very much appreciate, if it's not too presumptive, to appreciate your support in advance. Thank you.
Thank you. Let's go to the next person.
Good morning. My name is
Oh, you got to push the button.
Good morning. My name is Catherine Jacoby, President and CEO of the Nevada Restaurant Association. Thank you for the opportunity for public comment. Today, we're here in support of the work program List F, number 16, which will provide ARPA funds for the local public health agencies and their immediate needs. We recognize that the health district provides critical services for residents and visitors. Because health services are funded through revenue generated by licensed businesses, the Southern Nevada Health District Board voted to raise permit fees for restaurants by 27%. This fee will negatively impact our industry, which is struggling to rebound from COVID. Our industry sector was severely impacted by the pandemic, causing 30% of our restaurants in the state to close permanently, and others are still recovering. Our businesses are impacted by food costs, right now averaging 30% increase, added transportation fees, increased labor costs, and shortages, as well as inflation. Residents are also struggling with increased costs for housing, food, and services. Increasing a fee that is passed on is a serious burden at this time. We are asking for approval of ARPA funds for the health districts. Thank you.
Thank you very much. Let's go to the next person.
Good morning, Chair and members of the committee. For the record, my name is Dylan Keith, Manager of Government Affairs at the Vegas Chamber. I am also here to mirror my colleagues in supporting item F16. We believe that the extra staffing provided by this grant will not only increase stability for our small businesses, but also provide many improvements for our community and for the members of the community as well. And during this time, as many small businesses are struggling to stay open, the consistency and additional resources that this would provide would be incredibly beneficial, and we urge your support. Thank you so much.
Thank you very much. Let's go to the next person.
Good morning, Chair Dennis, Vice Chair Carlton, members of the Interim Finance Committee. For the record, my name is Alex Bybee, representing communities and schools of Nevada, a statewide evidence-based nonprofit providing stay-in-school support for 91 schools across the state of Nevada and providing case management to over 7,000 students in those schools. We're here today to offer our support to Agenda Item F and various investments from federal relief funds in children's mental health. Certainly over the last 2 years, our site coordinators, of which there are over 120 who are working in high-need schools every day, have found that more students across all grade levels, elementary, middle, and high school, are demonstrating an express need for mental health supports. And so we are grateful to the partners and advocates who've worked on ensuring that these investments are on the agenda today. And we know that these supports will provide needed relief to the students that we serve, again, on 91 school campuses in the Clark, Elko, Humboldt, and Washoe County School District. We want to quickly provide public thanks to one of our partners who's offered comment today. UNLV is the practice who we partner with to provide telemental health services in Elko and Humboldt County, given the shortage of mental health providers in the rural areas of our state, and also to the Family and Child Treatment Center of Southern Nevada and Quest Counseling in Washoe County. It's through these partnerships that our site coordinators can bring the community into the schools and alleviate barriers. So we urge your support of the various investments in children's mental health. Thank you.
Thank you. Let's go to the next person.
Hi, I'm Kathy Flanagan with the Southern Nevada Water Authority, speaking today in support of items F10 and F11. The Colorado River is experiencing severe and ongoing drought, which has dramatically reduced Lake Mead's water elevation to historically low levels. As a result of these dire conditions, the Lake Mead Fish Hatchery's water intake has been rendered inoperable, causing the hatchery to suspend operations until a new water delivery system can be designed and constructed. Over the years, the SNWA has engaged in successful partnerships with many local, state, and federal agencies. This crisis has created another opportunity for collaboration and partnership. The SNWA, the Bureau of Reclamation, and the Nevada Department of Wildlife seek to partner to implement a project for the design and construction of a new water pipeline that will convey water from existing SNWA intake facilities. The SNWA intakes are located at deeper elevations than the original hatchery intake. This will provide both a more reliable water source for the hatchery and better quality water, which will improve conditions for fish rearing. It is important to note that water used by the fish hatchery will be returned to the lake, so the project will not impact water availability and will not contribute to a greater consumptive use of water. This project is needed to get the Lake Mead Fish Hatchery back online so that Nevada can continue to implement the goals of the Lower Colorado River Multi-Species Conservation Program for the conservation of federally endangered fish and comply with the requirements of the Endangered Species Act. For these reasons, we respectfully request that you approve the use of these federal funds in support of this much-needed project. Thank you.
Thank you. Let's go to the next person.
Mr. Chair, members of the committee, Nick Vasiliadis on behalf of the R&R Purchase Foundation for the record, here to testify in favor of item F number 25, which provides allocation to fund diagnostic and therapeutic provider services, the Grant to Gift Autism Foundation. Plenty of people spoke before me on how crucial of a moment it is we are, especially coming out of COVID and what a lot of these kids went through. On a personal note, I wasn't diagnosed until age 20 with ADHD, and I can't tell you how relieving it was to finally find out what was kind of providing obstacles or providing struggles, especially in the academic space, and how much my life changed once I found out what was actually providing these struggles and coping mechanisms, and in some cases even medication to help provide a pathway forward. I think I can speak on behalf of every teacher who's ever taught that early diagnosis is the most important factor here. Getting to these kids as quickly as possible, finding out exactly what is causing any kind of struggle or any kind of obstacle in their life, and providing coping mechanisms, and yes, in cases, medication, to help balance any kind of chemical imbalances that are going on, to provide them with the most stable foundation moving forward. And so it's with our full-throated support that we hope that you guys find some additional money to allocate here, because I think you'll find that it is life-changing for the students who receive these kind of services. Thank you.
Thank you. Let's go to the next person. Is there anyone else in Las Vegas wishing to come forward? Okay, I am going
Chair, I don't think anyone else is here in Las Vegas.
Great, thank you very much. I am going to come, we're going to switch to the online, but first I've got 2 more people here. So while we're switching to the online, and I'm giving a heads up to everybody that's online, I'm going to go real quick to the 2 that are here in Carson City. So if you'll go ahead.
Thank you, Chair, Senator Davis, and committee. Thank you so much for caring about our state and our children. I'm Dr. Elizabeth Sexton, Mental Health Programs Administrator for the Washoe County School District, and I'd like to give you some information about item F in terms of caring for our kids. As one of the good doctors said, Nevada's 51st in the country for access to mental health care, but also for mental health outcomes. That's not 50th, that's 51st. With the closing of West Hills Hospital in Washoe County, Washoe County was placed in the extreme range in terms of access to emergency care. So part of my job is to assess and then provide supports for the kids with the most significant mental health and behavioral needs in the Washoe County School District. So I wanted to give you some statistics that might kind of put a name or a face to who we're talking about. In the 2021-22 year, of the students I evaluated, 55% of those kids met criteria for severe complex PTSD. This is in comparison to 7.2% in a typical population. So 55%. What these kids had experienced was broken bones over time, watching their caregiver almost be killed in a domestic violence incident, sexual assault and molestation going back to the age of 7 months or age 5. So these kids, 55% of the kids in my population were coming and trying to access school, carrying this burden with them. None of these kids had ever received a diagnosis or therapy or supports. 22% of my kids met criteria for fetal alcohol spectrum or for autistic spectrum or for something called other specified neurodevelopmental disability, which includes things like a traumatic brain injury, these quirky neurodevelopmental disabilities that we don't quite have a label for. And this is in comparison to about 1 to 5% in a typical population. So that's 22% of these kids had never been diagnosed, never received therapy, and never received appropriate supports. And then 7% of the kids met criteria for a psychotic disorder. Psychotic disorders lead to things like schizophrenia that are lifelong, severe mental illness. And that's compared to an incidence rate of 0.7%. And so 7% as opposed to 0.7%. Again, none of these kids ever received any kind of mental health intervention, care, or support. So we have an extremely limited mobile crisis team response team capacity. Our team is absolutely stellar and wonderful. There just absolutely is not enough resource in Washoe County. So there's no...
I need you to wrap up.
Okay, no capacity for crisis stabilization. So currently the process is the police are called for these kids. Then they are transported to an emergency room where they're either discharged or some of them are sent and held in the ICU for up to 2 weeks. I also have kids at our juvenile detention center who are mentally ill and have developmental delays. And so these children and our students deserve a life, and they are the future of our state. And so I'm asking you please to fund mobile crisis response teams with a focus on Washoe County and also support our system of care. Thank you.
Thank you. Let's go to the next one.
Thank you very much, esteemed chair and members of the committee. My name is Catherine Loudon, and I coordinate school counseling and social work for the Washoe County School District. And I am here to support this transformative and transformational proposal on behalf of the children's system of care. You've heard from so many others, and I don't want to duplicate, but this children's system of care, intensive in-home services, wraparound and intensive care coordination, respite, family, and peer supports are essential. Specifically, I will draw attention, like Dr. Sexton did, to F15, which is our need up in Washoe County for the support for the Division of Child and Family Services mobile crisis teams. We, working in the school, brokering services and support, need to have a community and a state that we can pass the ball to and that we can get support from, in addition to F5, which is integrating and co-locating a lot of our supports within our community. Thank you very much for your consideration on the behalf of our students and families.
Okay, thank you. So now we're going to go, BPS will help us to those that are online. I will mention, just for those of you that are online, there's over 50 of you, so just be patient. We will get to all of you, and just make sure that you keep your comments to under 2 minutes. Thank you. So BPS, if
provide
we can.
public comment.
Thank you.
Sorry, Chair. To provide public comment, please press raise hand in your Zoom window or *9 on your phone to take your place in the queue.
Kent Irvin, K-E-N-T-E-R-V-I-N, for the Nevada Faculty Alliance, the statewide association of faculty at the colleges and universities of the Nevada system of higher education. I would first like to echo the comments of Ms. Terry Laird of RPEN. To solve the state's crisis in employee recruitment and retention, public employees benefits program benefits must be restored to pre-pandemic levels, but that's not on the agenda. I speak today in support of item F1, funding for the Workforce Incentive Grants, WIG. This pilot program supports students in certificate training programs at community colleges who are not eligible for the other state-funded scholarship programs, namely the Governor Grand Millennium Scholarships, Silver State Opportunity Grants, and Nevada Promise Scholarships. The pilot funding for WIG is not sufficient to cover all students, but it's a good start to test student outcomes. There has been much discussion of free community colleges. Taking a 30,000-foot view, there are two ways to fund free tuition at public colleges. First, public funding for the colleges can be increased to cover the full cost. Or secondly, individual student grants can cover their tuition and fees. The former is more efficient, while individual grants require more administration and cause more confusion for students, especially if the funding is in the form of a complex alphabet soup of programs, GGMS, SSOG, NPS, WIG, Pell, etc., each with different eligibility requirements. If a student becomes ineligible for one of the programs, it can cascade and cause them to drop out entirely. As you evaluate the future success of the pilot WIG program, Workforce Incentive Grants, please keep in mind how these scholarship programs do or do not work together and their administrative costs. Thank you very much.
Thank you. Let's go to the next caller.
Hello, my name is Daniel Clark. I'm a parent of 2 children, and to the members of the Interim Finance Committee, thank you for hearing me today. I've never given testimony before, so please bear with me. I'd like to talk for a moment about my experience as a parent. One of my children has always been a bit different, and we could always tell that he was going to need some extra attention, but recently when he started expressing that he wanted to die, we had no idea what to do. We started reaching out anywhere that we could, and they said that they didn't know where to send me. Nobody knew what to do or how to help me. He's 6 years old, and eventually we tracked down a program called Mobile Crisis that was able to help us navigate all of this, but we're still waiting for a full assessment to kind of understand what's going on with him. We're in a better place now, but as a person, I have some privilege that most families probably don't. I speak English, I have insurance, I have an education that has helped me understand mental health, and I have connections with some organizations in Nevada already, and I have luck. I don't know how it's done, but we need more psychologists and psychiatrists that can help children and parents in crisis just like me. Thank you very much.
Thank you. Let's go to the next caller.
Hi, can you hear me?
Yes, go ahead.
Hello. Hi, my name is Maya Baudet. I am the mother of 2 autistic children, and I have a foster baby that's drug exposed that I'm taking care of as well. I want to talk to you today about a few things. I want to talk to you about a program that you guys are looking at, that you already signed for a few years ago that actually helped my kids, and I want it to continue. For example, my kids were able to go to Ackerman Autism Center in early intervention, and it made a huge difference in their life. Now my son is more functioning, he's easier, he understands, and that's huge for him. But once he aged out, we don't have any more services. We don't have resources. He can't go anywhere. We've been on a list with another company for about 6 months now, and we're still not sure when are we going to get resources. Therapists are in and out of our house, and they have a rotating door because I don't think they get the support. I don't think they get enough money to stay in this profession because it's a really difficult profession. So I'm calling you today because I want to tell you, please consider that. Please consider that for my kids. Also, I'd like you to consider that it actually affects us parents. We want mental health support for us as well towards our children, because I'm left to choose between a 10-year federal career and staying home full-time taking care of my kids, and actually giving up on my career completely to stay home and care for my kids, to give them that full-time because they don't have resources, and I'm left to pick up the pieces. Imagine what $3 million would do to children in children's life compared to renovating a building that's probably going to go old in 10 more years. Think about the future. My kids, I actually had to enroll them in Duke University, Harvard, for laboratory services, that, another thing on your agenda, for genome testing. The genome testing came back normal. It was just hours, and it was very expensive. It was $8,000 towards it, and we paid it, but we didn't get a result. It was just hours and months of waiting for no results. Think about the next generation. When you're old and retired.
I need you to go ahead and wrap up.
Sure. When you're old and retired, think about 30% of the population needing mental health and 70% is not able to keep up with it. Who's going to take care of you? Think about the future generation. Mental health is crucial for the future generation. That's what civilization is built on. Thank you for listening to me today.
Thank you. Let's go to the next caller.
Hello, this is Patrick Donnelly, PatrickDonnelly. I'm Great Basin Director with the Center for Biological Diversity. I'm calling today in support of items number F10 and F11, the Lake Mead Fish Hatchery. It might seem a little obscure to be using these funds to fund intake for a fish hatchery. However, the operations of the Lake Mead Fish Hatchery are essential to the Lower Colorado Multi-Species Conservation Plan. And that plan is part of the permit to operate Hoover Dam and Glen Canyon Dam. The only way that the operation of those dams and the Colorado River as a whole is in compliance with federal law is through the Lower Colorado Multi-Species Conservation Plan. And so that, in turn, enables Las Vegas and the Southern Nevada Water Authority to get water out of the Colorado River. So a functioning Lake Mead fish hatchery is essential for ensuring the future water supply for Southern Nevada and people across the Colorado River Basin. So we urge you to fund this important infrastructure project for the Lake Mead fish hatchery. Thank you.
Thank you. Let's go to the next caller.
Hello, my name is Julie. Good morning. I reside in Washoe Valley, Nevada. I have a 15-year-old daughter. Her name is Ashley. She was misdiagnosed back when she was 8 years old. I had her tested for autism then. She has been in and out of therapy. It's been a real struggle trying to find therapy in the Reno, Carson City area. She was recently in Reno Behavioral Health for the last school year. They couldn't really help her there, so they had sent her out to Copper Hills Youth Center, and that was in Salt Lake City, which was crazy because that's 8 hours away from me. So I had to commute back and forth there a few different times. And while she was there, she was recently diagnosed with autism spectrum disorder. This requires support and also mental health diseases that include bipolar, PTSD, and personality disorder. It is really sad that I had to, go and commute so far away. It would really be nice to get more support here in the Reno, Nevada and Carson City area. This has been a struggle for many, many years since my daughter was young. There's always been something going on with her. And right now I'm still waiting list for autism help for the ABA therapy, which can be what it sounds like for a long time. And I'm just wishing that there would be way more support in the Nevada area, because right now it is a real struggle, having a 15-year-old with so many disabilities. And I don't know how to help her, and trying to find help is hard. So it's not like a cold where I can just give her some medicine and fix it. So I would really appreciate you guys to help me and help our community in finding more support. And I would like to shout out Nevada PEP and Wraparound Nevada for all of their help in the recent months with me and my daughter. Thank you so much. And thank you guys for allowing me to speak.
Thank you. Let's go to the next caller.
Good morning, Mr. Chair and members of the Interim Finance Committee. My name is Ann Silver, and I serve as CEO of the Reno Sparks Chamber of Commerce. and I'm speaking in support of Washoe County Health District's request for a building to provide a satellite location for clinical services. The time for reckoning with our public health resources is long overdue. Extensive population growth, the inability to hire much-needed medical professionals, the lack of school and hospital nurses, the rising cost of health care, and the negative consequences of illness on commerce, such as we experienced during the pandemic, make clear the need for an expanded site where residents can be screened for infectious diseases, get vaccines, and be seen by an in-person professional. The $10 million request from the Washoe County Health District is not unreasonable given the vast scope of Nevada's ARPA money and the impact it can have on critical health care needs in our community. An additional permanent site to address future demands and the wellness of a growing population seem like a positive yes vote for this committee. Thank you for your time and attention.
Thank you. Let's go to the next caller.
Good morning, Chair Dennis and members of the IFC committee. My name is Caleb Cage, and I'm here to provide support for item K, which is a request to remove assessment from 4 counties to the Division of Public and Behavioral Health for Public Health Services. Having been a part of the statewide COVID-19 response, I can tell you that we learned a lot of lessons, and some of those were that these were not enough, or that there was not enough focus and investment in public health throughout the state prior to the pandemic. We learned that we needed to be more regional in our work, in our investment, and we saw the importance of partnership between state and local governments. This request, this request under item K for the removal of the assessment for provisions of services from the state is a critical step forward. It's a first step forward, but a critical step forward for Churchill County, Eureka County, Mineral County, and Pershing County as they take affirmative, intentional steps towards supporting local investments in the area of public health. I support this request, and I urge you to as well. Thank you for the opportunity.
Thank you. Let's go to the next caller.
Hello, my name is Carly Murray, and I am the parent of 2 teens with mental health difficulties. I support investing more to children's mental health services in Nevada. When we moved to Nevada, it took nearly 5 months to get mental health services set up for my kids. This probably is a combination of not having enough providers and providers who have long wait lists due to the number of people needing these services. So during the time that we were waiting, their mental health continued to suffer, and it affected our entire family. Children's mental health is a critical issue in Nevada, and our children deserve better. Thank you for taking the time to listen to my piece of the story and for investing in Nevada's children, youth, and families.
Thank you. Let's go to the next caller.
Caller with the last 2 digits, 375. You're unmuted and may begin.
Hello, my name is Janet Quintero, and I'm the Vice President of External Affairs at United Way of Southern Nevada. As a nonprofit organization who has served our community for 65 years and focuses on building capacity in student success, workforce development, and community support, I'm calling in support of various items under Section F that include significant investments in rental assistance, lowering costs for higher education, and support for public, behavioral, and mental health programs that will support children and families in our state. I also want to take a moment to thank the chair and members of the committee for prioritizing these important programs in historic investments. Thank you so much.
Thank you. Let's go to the next caller.
Good morning, Chair Dennis, Vice Chair Carlton, and members of the committee. My name is Andre Wade, Andre Wade, and I work as the State Director for Service Data Quality We're a statewide LGBTQ plus civil rights organization here in Nevada. I'm also a member of the Governor's Task Force on HIV transmission exposure modernization. I'm providing public comment on the request for funding for monkeypox campaign, and from here on out, I'll refer to monkeypox as MPX. It's critically important that the funding for MPX is approved, as we may still have a window of time and opportunity to address the spread of MPX before it becomes endemic to gay, bi, and men who have sex with men populations, and before MPX spreads to other populations, as the virus does not and will not discriminate. To date, there are 100 suspected or known cases in southern Nevada and 8 in northern Nevada. These are the only cases we know about, which have grown from about 5 known cases throughout the state at the beginning of the month to 108 less than 3 weeks. Nationally, and unfortunately, MPX disproportionately impacts Black and Hispanic people. In southern Nevada, we are faced with our Pride celebration, which will bring thousands to the city to celebrate. We have to do our best to get information to the community at large, the LGBTQ plus community specifically, the visitors and tourists, in addition to healthcare providers and anyone, which is everyone, who can be exposed to MPX. Inaction only means that the general public at large will soon have a public health crisis to contend with. We must treat MPX as a growing public health concern that has the potential to disrupt our lives. Now, I will say that compared to my colleagues in other states, Nevada's Department of Public and Behavioral Health response has been fairly quick and swift, which is very appreciated. I urge you to approve the funding request so that we can get information and resources to Nevadans and to those who visit our great state. Thank you.
Thank you. Let's go to the next caller.
Hello. My name is Judson Parkin, a father of 3, sole care provider. 2 of my children are on the autism spectrum. I'm a decorated Marine Corps veteran with 2 tours and an engineer by trade, but I'm presently out of work. For reasons beyond our control, we fled to Nevada and are living in hiding. Despite over a year of advocacy, my children are still without services. Please consider supporting children's mental health services. And I want to thank you, all the parents that called in, for the same reason.
Can't tell if you've finished. I think so. Okay, let's go to the next caller.
Good morning, Chair and committee members. My name is Grayson Whitehorn, GREYSONWHITEHORN. I'm a youth facilitator for Youth Move Nevada. Youth Move Nevada is a youth-inspired and youth-led organization that encourages and empowers our youth peers to unite together to engage with youth-serving systems. We recognize the power of lived experience and are also a strengths-based bridge to improving support services for youth by youth through our shared experience and expertise. I'm speaking to you today on behalf of our youth members. During the public health emergency, youth across the state were put under enormous strain of having to navigate education in a virtual environment, and some students didn't have teachers once they went back to school. Many also had to access mental health in a virtual environment. And while many may be resilient enough to bounce back from the traumatic impacts of COVID-19, others are not, and they need access to timely quality mental health care to recover. Even before the U.S. Surgeon General had alerted the nation of the youth mental health crisis across the country, Nevada's mental health care was in crisis and rated 51st. The agenda items before you today related to children's mental health care are critical to ensure that the youth of Nevada have access to quality services that will help to ensure that their mental health needs are addressed in a trauma-informed and culturally responsive way. Thank you in advance for investing in the future of Nevada's youth.
Thank you. Let's go to the next caller.
Good morning, Chair Dennis and members of the Interim Finance Committee. My name is Shar Frost, and I serve as the chair of the Clark Regional Behavioral Health Policy Board. On December 7, 2021, U.S. Surgeon General Vivek Murthy issued an advisory on youth mental health crisis. In Nevada, advocates for children, youth, and families applauded this bold statement. But families of children and youth with mental health needs have known for quite some time that we were in crisis. Mental Health America has consistently rated Nevada children's mental health at 51 for the last 5 years. In 2021, youth ages 12 through 17, it is estimated that 17.93% have experienced a major depressive episode in the past year. Unfortunately, half of those same youth have not received any treatment. This was a significant increase from 2020 numbers of 15.11%. We know that if ignored, mental health problems lead to further problems for children and youth. We also know that intervening early may prevent further complications and problems from arising, such as an increased risk of out-of-home placement, whether that is a residential treatment center, juvenile justice facility, or child welfare. But even when families try to access care, they are put on waiting lists, or instead of a waiting list, they are given an appointment weeks or months later. If a family is seeking a neuropsychological evaluation, it can be a wait of a year or more in many instances. These issues often disproportionately impact low-income and BIPOC populations. In addition, the lack of an array of community-based services and supports in Nevada pushes youth into higher cost, more restrictive treatment options. And the members of my board would not be surprised that I also have to say that another population that is disproportionately impacted are our rural and frontier communities, and those kids are just as important. All of our children are important in Nevada. The investments that you are considering today will impact children, youth, and families in a positive way, making it possible for many to find the right kind of help at the right time. Thank you very much for your time and your consideration.
Thank you. Let's go to the next caller.
Good morning, esteemed chairs and members of the Interim Finance Committee. My name is Dr. Tiffany Tyler Garner. I'm calling on behalf of the Children's Advocacy Alliance to echo the many who stand in support of critical investments in children's mental health. I implore you today to consider approving the proposed investments. I also thank you in advance for any consideration you will give to any investments that further our public health systems, as well as provide targeted support to children with special needs, such as those who might find themselves on the spectrum. Today's opportunity has been a long time coming. And as we face what is a national children's mental health crisis, the fact that we are at this stage says so much about the possibilities and future for our children. So I thank you for any consideration you may give. Again, implore you to approve critical investments in children's mental health and any investments that will move our health forward together as Nevadans. Thank you for your time today.
Thank you. Let's go to the next caller.
Hello, my name is Tony Blair, and I'm the parent of 2 kids with mental health issues. I fully support having more mental health for children and as well as adults in Nevada. We have had trouble finding help for our children and for our son who have multiple issues, medical and mental. We have been turned down for many placements because of his medical needs. He is a type 1 insulin dependent, and as well as getting physical. He has many mental health issues, which include schizophrenia and bipolar, ADHD, reactive attachment disorder, ODD, ADD, and DMDD. And our daughter has autism and intellectual disability. And there really isn't anything available out here in northern Nevada, even medical. We are having to transport our son to endocrinology in the state of California to UC Davis because there is only 3 endocrinologists in the northern Nevada area, and they are not accepting him as a patient because they're not accepting new patients, or they do not accept pediatric, and he is 15. We fully support it. We need it. Even the mobile crisis and rural crisis cannot help because we are too rural. They can do video, but because of our son's mental health issues, he cannot sit and do video to try and calm down or for us to get emergency help. We have had to resort to calling the police. He has been arrested. He is on probation now. And he's actually a really good kid otherwise. And he's intelligent. So it would really be great if we had good mental health that could work with him and help him to be successful in life. I fully support it. I hope that there is a way that we can get more here in the state of Nevada to help our children. Thank you very much for your time. I appreciate it.
Thank you. Let's go to the next caller.
Good morning, Mr. Chair, Vice Chair, members of the committee. My name is Carissa Toshiro. I'm an attorney with Nevada Disability Advocacy and Law Center, and I'm speaking with respect to agenda item F, and specifically the items related to children's mental health. I just want to echo the comments of so many others. We urgently need to develop a trauma-informed, community-based behavioral health care system for children in our state. Nevada ranks 47th in the nation in overall child well-being. We have substantial numbers of kids who have been impacted by mental illness and trauma, with 22% of Nevada kids having at least one developmental or behavioral health condition requiring treatment. Our existing mental health care system deprives these children and youth of the services they need to heal and to thrive and to become healthy, functioning, contributing members of our communities. In my many years of work in disability law, I've encountered families who were told that the only way to access services for their children was to relinquish them to state custody, families who are so desperately struggling while on wait lists for services, families who are told that the only treatment option for their children is to put them in residential facilities, sometimes out of state. And I've seen the horrific abuses that happen in those facilities, as well as children who languish there for years, not because they need that residential level of care, but because there is nowhere else for them to go and no option for them to receive services at home. The services we need are community-based, trauma-informed, and evidence-supported therapeutic treatments for children with complex trauma and mental illness, things like high-fidelity wraparound, intensive case management, mobile crisis response services, and intensive home-based services. And then in addition, we need an intermediate level of care for youth who might not quite be ready to be served in their homes, but who also don't need acute or residential care. There are many states that have treatment foster care funded as a Medicaid service. In treatment foster care, youth with emotional or behavioral issues receive intensive services in a home setting with specially trained foster parents. And if we had this service in Nevada, it would be radically transformative for so many kids and families who now are turned over to state custody or to facilities. So thank you so much for your time and for considering how we might begin to transform Nevada's children's behavioral health system as you allocate ARPA funding for the benefit of our kids.
Thank you. Let's go to the next caller.
Caller with the last three digits, 950. Please press star 6 to unmute.
Good morning. My name is Brittany Young, and I'm a parent. I live in Reno, Nevada, with a 10-year-old son that has a diagnosis of autism, ADHD, as well as mental health needs. It hasn't been an easy road for us with getting services and supports for my son. We were on a 1-year wait list just for the ADHD diagnosis and have struggled to get mental health supports in our community. I was told different things by many different providers and kept getting the runaround when it came to my son's mental health. I felt so isolated and frustrated with the lack of services and providers in our community. But with the support of Nevada PEP, I no longer feel alone, and I have learned to ask for my son and his needs. Please help families like mine get access to support, programs, and services we need so desperately. Thank you for your time.
Thank you. Let's go to the next caller.
Caller with the last three digits, 445. You are unmuted and may begin.
Yes, hello, good morning. Can you hear me?
Go ahead.
Yes, good morning. Can you hear me? Hello?
Yes, go ahead. We can hear you.
Oh, okay, thank you. Good morning, everyone. My name is Victor Sanchez. I'm calling from Clark County here in Las Vegas. And I would like you to know the importance of mental health services. My grandson is 10 years old and he's autistic, and he does not speak complete sentences. So he cannot communicate, making him very frustrated when he has a simple thing like a stomach pain or toothache. Speech therapy is of the most important things for him and his future, as well as other programs to help him to develop to become a more a normal person, of being able to communicate and be able to express himself. Our city keeps growing, and we should be taking care of our most vulnerable, which is, it's them. So thank you very much for your time, and I would like you to know that.
Thank you. Okay, let's go to the next caller.
Good afternoon, Chair Dennis, Vice Chair Carlton at Interim Finance Committee. My name is Jerry Burton. It's Jeriburton, and I'm the co-executive director of the Nevada chapter of the National Organization for Women. I'm calling in support of line item F regarding the ARPA request for funding for children's mental health in Clark County. We know there's a tremendous need in our community to provide appropriate mental health services for our children. I'm also calling as a grandmother of two children with autism. And we know how little access we have in Nevada for children with mental health needs. When my one grandson was diagnosed, it was suggested that we move out of Las Vegas and go to California, where there was better care. But we're natives to Nevada. This is where my family has raised children since my grandparents moved here in the 1930s. So that is obviously not the answer. We live here. We need better access to mental health care here in Nevada for our children. So I'm asking for this funding as a grandmother, but also as a leader of the National Organization for Women in Nevada. This is such an important issue for our members, and we appreciate you considering this request. Thank you.
Thank you. Let's go to the next caller.
Hello there. My name is Debbie Biasotti, and I am a grandparent that is raising two young children, 4 and 6 years old, born from a heroin-addicted mom. Both suffer from some learning delays, hyperness, and major behavior issues. My 6-year-old grandson has been diagnosed with severe ADHD and mood dysregulation disorder. It took us over a year to even get that appointment for that to happen. He's barely being treated or being medicated for ADHD, and there's no ability for us to get ABA therapy here in Fallon. His sister is in the beginning process of being evaluated now, and Pappy and myself, we're in our 60s and have had these kids since birth with no family or friends for support. So it's been pretty much 24/7, 365 with no kind of respite. And I've had to give up a job, and because it's been a full-time thing trying to work with these two children and get services for them. It's been really difficult the past 3 years to even get the services that we have been able to get. In addition, there's not a lot of testing or support for kids of drug-addicted mothers. It's all either for alcohol, fetal syndrome, or autism. And we kind of fall in the cracks there. And no one wants to or is trained to work with kids under 6. Ideally, they want them to be 8 to 10-year-olds. Not addressing the problems for these younger children puts them and the caregivers at a higher risk for more problems as they get older and less ability to function and grow positively as they should. The behaviors are more permanently embedded by then. We need more programs to work with the behavior problems and or daycare for the caregivers, especially who have little to no support. And we definitely need prescribed medications to help these kids slow down and focus, in particular for the ones under 6. We need these programs in the rural areas like where I live in Fallon. So I support your investment into the children's mental health, especially in these areas. Thank you very much for your time and consideration. I'm glad you guys are doing this.
Thank you. Let's go to the next caller.
Hello, my name is Elisa Klein, and I'm a parent. When my son was about 16 months old, I started noticing changes in his development. He was eventually diagnosed with autism spectrum disorder and ADHD. When we moved to Nevada, the challenges became more difficult. There were so many transitions that were made, and my son struggled with them. Since we moved here, my son has attended more than 4 different schools, and each transition would be worse than the last, and his behaviors became more challenging. Someone in the community told me about Nevada PEP, and I called immediately, anxious for any assistance that they could offer. I was given a wealth of information, training, and support to become a more effective advocate for my son. I was so impressed by the support that my family specialist gave me that I wanted to do for other families what she had done for mine. We face many challenges each and every day in school and out in the community. My son is my pride and joy, and I will continue to find as much as I can to help him to be more successful. There is no doubt in my mind that his future will be great. Although I continue to have great challenges with my son, I use my experiences as well as what I have learned from Nevada PEP to help support other families with their struggles. Please invest in children's mental health services in Nevada. Thank you for your time.
Thank you. Let's go to the next caller.
Hi, good morning. My name is Anna Whitehead. I am a parent and an early Head Start educator. As an adult who struggled trying to find mental health services in Clark County, as a child, I am now facing the same problems trying to find services for my daughter. Early intervention is the best prevention. And through Nevada PEP, I have been taught and empowered to become an advocate for myself as well as my daughter. But how much advocating, how much will advocating help if we don't have the proper funding for the services? When Governor Sisolak said that these kids need to know that there's someone that can help them in support of the 3-digit fast code for suicide prevention hotline, we also need to let them know that there are resources in our community that will not make them wait 6 months, 1 year, 3 years to be heard, to be appreciated, and to be empowered into continuing their lives. While suicide is the leading cause of death for Nevadans 12 to 18, it is also the second leading cause of death for Nevadans 8 to 24. I support your investment in children's mental health well-being and their futures, as well as parents' futures. Thank you for your time.
Thank you. Let's go to the next caller.
Good morning. My name is Deshaun Jackson. Good morning, Chair and Vice Chair and committee members. I have the privilege of serving as the Director of Children's Safety and Welfare Policy with the Children's Advocacy Alliance, as well as leading Nevada Foster Youth Advisory Board. I'm also a foster care alumni and a former resident of Child Haven. As someone who has utilized mental health services in Las Vegas, I understand the importance of equitable access to these services. As mentioned by Barbara Buckley and so many others, there's a critical need to invest in the mental health needs of children in Nevada. As research has shown, the need to make an impact is now. The need to address many of these challenges families are facing is now. With rising costs, housing instability, and food insecurities, the need to invest in Nevada's children and families is at an all-time high, and action is imperative. I end with this. Mill Postman stated, "Children are the living messages we send to a time we will not see." So the need to invest is now. Thank you.
Okay, thank you. Let's go to the next caller.
Good morning, Chair Dennis and Committee. This is Annette Dawson-Owen, serving as the School Readiness Policy Director for the Children's Advocacy Alliance. I, too, am calling in to support mental health investments for children and families. I cannot say it better than our many parents have who have called in telling their stories, who have been sharing their lived experiences, and who are requesting our support. I, too, ditto the comments of Barbara Buckley, Lisa Cannell-Burkhead, Danielle Musgrove, Yvette Williams, Alex Spivey, Kendra Gibson, Deshaun Jackson, Dr. Tiffany Tyler Garner of our organization, and many more. We must invest on the front end with these mental health services. These are some of the best return on investments we can make while also securing Nevada's future. Much appreciation, and thank you for all you are doing to move Nevada forward.
Okay, thank you. Let's go to the next caller.
Caller 686, you are unmuted and may begin. Caller 686, we cannot hear you. Is it possible your phone is on mute?
Good morning. Are you able to hear me?
Yes, go ahead, please.
Thank you so much. My name is Jamel Nance. I am the Director of Prenatal to 3 Initiatives with the Children's Advocacy Alliance. I'm so excited to be here today to advocate for the revisions to the American Rescue Plan Act under Item F. And I also am representing the our Health Policy Director as well, who could not be here. But I wanted to just share with you specifically those that align with the support of children's mental health. I think just echoing the thoughts of my colleagues and those who have come before me and testified today, how important these investments are for our young children. Nevada's children and families need these proposed investments to support them and provide needed stability to their health and well-being. The disruption to learning, social development, and job security that resulted from the pandemic is still ongoing, and investments in school-based mental health as well as early childhood mental health providers and other wraparound family support services are crucial as families continue to rebuild in the coming years. I would also like to echo Mrs. Buckley. Her comments were spot on, and we want to just uplift what she has shared with us today. Previous comments of her support of the Ackerman Center and services that support children with autism. We just urge your support of those items that are proposed today under Item F. And we want to thank you so much for your ability to allow us to provide public comment this morning. Thank you.
Thank you. Let's go to the next caller.
Hi, my name is Travis Hawks. I live in Douglas County, Nevada. Thank you, Chairman and committee members. I just wanted to voice my support for F11. Nevada's wildlife populations are facing threats from all directions, and unfortunately, they don't receive the attention needed, nor can they speak for themselves. Those threats are urbanization, climate change, loss of habitat, lack of devoted funds, resource utilization that's leading to species level impacts. F11 will fund a small project that is an important opportunity to help the Nevada Department of Wildlife protect uniquely Nevadan species for years to come and prevent the loss of Nevada's biodiversity in the southern part of the state. I appreciate the support for item F11. Thank you.
Thank you very much. Let's go to the next caller.
Caller 585, you are unmuted and may begin.
Hi, my name is Joanna Gonzalez. I'm a parent of 2 girls with mental health needs. I support the investment in children's mental health care in Nevada because there is a long waiting list for community services. It took me 3 years just to get one of my daughters evaluated due to a lot of providers not accepting her insurance. Please provide more services in mental health services. Thank you for your time.
Thank you. Let's go to the next caller.
Caller 326, you need to press *6 to unmute.
Hi, thank you for this opportunity. My name is Christina Klinger. I'm a biologist and a concerned citizen. I would like to voice support for agenda items F10 and 11. I support providing funds for the water delivery system for the Lake Mead Hatchery. Among other things, this project is immensely important for conservation of Endangered Species Act listed fish, specifically the endangered bony-tail and razorback sucker. Again, I support items F10 and 11. Thank you.
Thank you. Let's go to the next caller.
Caller 303, you need to press *6 to unmute. Caller 614.
Good morning, Chair Dennis.
You're unmuted, may begin. Sorry.
Good morning, Chair Dennis, Vice Chair Carlton, and members of the committee. My name is Michelle Mayese. I'm the president of SEIU, Local 1107. We represent 19,000 workers in Nevada, 11 hospitals, 39 Clark County departments, LVCVA, DOA, Water Reclamation, Southern Nevada Housing Authority, Regional Transportation Commission, and Southern Nevada Health District. SEIU is in support of line item F and all agenda items regarding ARPA requests for funding for children's mental health. And we thank the committee for hearing us today. We echo the previous testimony for the overwhelming need to provide mental health services for our children in Nevada. For 15 years, I worked as a supervisor for family services, specialized unit for abused and neglected children, fatalities, near fatalities, and sex abuse. Over 200 SEIU essential employees work on Child Haven campus and provide direct care for our abused and neglected children on a daily basis. I also want to recognize the SEIU members who work in juvenile justice, along with the thousands of nurses, Parks and Recreation members who work directly with our most vulnerable population and who witness the needs for mental health services for our children on a daily basis. In 2014, SEIU DFS members led a Safety First campaign for the safety of our children and members. Additionally, in January of 2021, SEIU began leading conversations with DHHS Director Whitley, DFS, and DJJS regarding the permanency, safety, and well-being of our children, increased mental health services, appropriate placements, and safe working conditions for our members. Chair Dennis, we thank you for standing in solidarity with us on the front lines in October 2021, when over 100 SEIU family services workers, including Child Haven staff, led a protest outside of Child Haven demanding more mental health treatment, mobile crisis teams for our children, safety in the workplace, increase of staffing issues and ratios. We ask that Oasis Treatment Center remain open and utilized as safe and appropriate placements for children in need of mental health treatment who could not return to their families at that time. SEIU is in support of additional mental health services on behalf of our children, as well as a checks and balances plan for the financial recipients to come back in front of this committee to ensure the timeliness and implementation of programs, staff hired, and support for those hired, and to provide this committee with data and progress made on the monies allocated. We believe in all children, and we thank the families, community providers, leaders, caregivers, educators, elected officials, attorneys, advocates, and Ms. Barbara Buckley, who spoke up for children today and every day. We are grateful that this IFC committee has been tasked with the approval of these funds, as this allocation will be a transformative change that our children need and deserve as they are our future. So on behalf of the 19,000 workers SEIU represents, our families, and our children in Nevada, we thank you, Mr. Chair, and the committee for your time.
Thank you. Let's go to the next caller.
Good morning. My name is Kevin Metzer, and I'm an outdoor enthusiast here in support of agenda item F10 and F11. An operating lake meat fish hatchery is critical to the conservation and recovery of species such as the razorback sucker and bony-tailed chub. Thank you.
Thank you. That was short and sweet. Thank you very much. All right, let's go to the next caller.
Caller 476, you need to press *6 to unmute.
Good morning. I appreciate this opportunity to speak to you all today. My name is April Harris, and I am a parent. I support your investment in children's mental health care in Nevada. Here in Las Vegas, I became a foster mom to a baby boy, and I later adopted him. He has ADHD, fetal alcohol syndrome, oppositional defiance. He is now 15 years old. He has dealt with mental illness where he was hospitalized for over a week and also received 10-day outpatient services. Without these things in place, my child may have been lost and possibly taken his life. Please invest in children's mental health care. It is imperative that you do because it may and will help save a child's life. Thank you so much for your time today.
Thank you. Let's go to the next caller.
Good morning. My name is Brandon Sanger, and I'm a resident of Southern Nevada. I'm calling this morning to voice my support for agenda items F10 and F11, which will provide funding to construct a new water supply line for the lake meat hatchery. The unprecedented declines in lake levels of lake meat has made this project necessary. Without this project, the hatchery cannot receive water and will not be able to operate. The hatchery raises and stocks 2 endangered species of fish, the razorback sucker and bony-tail. Both of these fish are native to Nevada and have historically been affected by the Colorado River being converted into reservoirs and by the establishment of non-native fish. Raising these Nevada native fish in hatcheries and stocking them back into the wild is absolutely necessary to prevent their extinction and to make meaningful progress in conservation. This new pipeline will allow the hatchery to continue to raise and stock native fish for decades, ultimately playing a critical role in conserving Nevada's native wildlife. Our state's Nevada native wildlife is an important part of our state's heritage. This project will support our state's heritage. Thank you for your consideration.
Okay, thank you. Let's go to the next caller.
Caller with the last three digits, 187. You are unmuted and may begin.
Hi, my name is Isabel Sanchez. Can you hear me? Hello?
Go ahead. We can hear you.
Oh, okay, thank you. Yeah, I'm a parent of an autistic child, and I've been receiving services. He's 10 years old. He has severe autism, nonverbal, he speaks selectively, but I've reached out to Barbara Buckey. I've reached out to Lori Roberts, to anybody and everybody that knows anything in Las Vegas. We've gone through over 150 residential treatment centers. We've all been denied either because Medicaid, they won't take Medicaid. The state doesn't want to pay. The school district doesn't want to pay. Getting help for him is unbelievably just a tackle. I mean, he didn't go to school for the last 3 weeks because of summer school. He knocked his adult tooth out just from one headbutt. I've done critical PCM training. I have ABA therapy coming, but they don't come, so everything is on the phone. He's either going to kill himself or someone else, and he's only 10 years old, and it's getting bigger and bigger. And he's a good kid when he's okay, but he has a hard time speaking. So I think just the services here for mental health, I really believe is needed. It's like, I believe we're like one on the bottom of the state for children, and him just hurting other people and hurting himself he can't speak for himself. So I just please help these children. That's all I'm asking, please. Thank you.
Thank you. Let's go to the next caller.
Caller with the last three digits, 809. You are muted and may begin.
Good morning. My name is Kim Tisdale, and I'm commenting on agenda item 10 and 11, actually F 10 and 11. I'm asking you to support the water delivery project for the Lake Mead Hatchery under the environmental category of the ARPA. This pipeline is essential to continue the ongoing operations at the Lake Mead Hatchery for the conservation of bony-tailed chub and razorback suckers. These fish are native to the Colorado River Basin and are both on the endangered species list due to dam and reservoir construction and other human-caused disruptions, which have resulted in limited reproductive success and critically low population sizes. Biologists working to conserve these fish have had success rearing fish from captive stocks in the Lake Mead Hatchery, which are then released into their native habitat to support and augment these declining populations. A reliable water source to the Lake Mead Hatchery is critical to allowing these efforts to continue to ensure the future persistence of these endangered fishes. Thank you for your time and consideration on this matter.
Thank you. Let's go to the next caller.
Hello?
Yes, we can hear you. Go ahead.
You're muted and may begin.
Okay. Hi, Interim Finance Committee. My name is Sofia Sanchez, and I am a temporary legal guardian for my nephew with autism, FAS, ODD, DDMD, OCD, bipolar NOS, and ADHD. I support your proposal to invest in children's mental health in Nevada. We only receive ABA therapy, and he's been in ABA therapy since he was 4, and it hasn't worked, at least not for in-home. It only works in clinic. And because we were not told about parent training until this year. There were no other options given to us. We were told our only other option, if we can't handle him, would be to give him over to CPS or press charges on him, and we would be responsible for making sure he follows what the court says. However, that would be impossible because of his behavior. We can barely take him to the bus stop for school. And if we give him over to CPS, we will have charges against us. Also, I have experienced barriers to finding RTCs and group homes in our state and facilities that are contracted with Medicaid out of state. So again, I wholeheartedly support investment in any services and programs that would provide families with increased and much needed children's mental and behavioral health services. Thank you for your time. And also I wanted to say that my nephew, two people have told me that out of the 20 years that they've worked with him, or worked with, children with mental disabilities and autism, he's been the worst case they've ever seen. And I just, like, there's literally no help at all, like, whatsoever. Like my sister spoke earlier, Isabel Sanchez, he has severe SIB, self-injurious behaviors, and he property damage, aggressive. He attacks us like he's gonna kill us.
I need you to wrap
We
it
have
up.
to have our neighbor help us. I'm sorry. We need help. We need help from our neighbor to help us control him, because he's out of control, and we just have, there's just no help. So if you could please help us with this, we would. I know plenty of families that are going through the same thing, and we would greatly appreciate the help.
Thank you. Let's go to the next caller.
Caller with the last three digits, 820. You are unmuted and may begin.
Good morning, Senator Dennis, Vice Chair Carlton, and members of the Interim Finance Committee. Thank you for the opportunity to comment on item F, numbers 12 and 15, which propose $172 million being considered to improve Nevada's public health system. I'm Andrea Gregg, Chief Executive Officer for High Sierra Area Health Education Center, also known as AHEC. I'm also a proud alumnus of the University of Nevada, Reno School of Public Health, and have spent the last 15 years leading an organization that serves as a critical convener between academic, employer, and community-based partners to develop, diversify, and distribute the healthcare and public health workforce needs of our state. A sound and sustainable public health infrastructure is an urgent matter. The proposed academic health departments are an innovative solution for the public health ecosystem, bringing together interdisciplinary professionals and cross-sector collaboration. These investments will provide a historic opportunity to invest in the public health workforce and build for the future while ensuring that health outcomes improve over the long term. In addition, this investment will yield a substantial rate of return and provide an invaluable opportunity to restore our state's public health, as well as behavioral health, primary care, and social service systems, ultimately protecting and improving our population's health, improving our healthcare workforce capacities, eliminating disparities, and advancing health equity. Thank you.
Thank you. Let's go to the next caller.
Good morning, Chair and members of the committee. For the record, my name is Tess Opferman, and I'm here on behalf of two organizations this morning, the Nevada Women's Lobby and AFSCME Retirees. I know you've heard a significant amount of testimony this morning, so I'll keep this quite brief. On behalf of the Nevada Women's Lobby, we strongly support the allocation of $25 million to rental assistance and eviction diversion, which will help women and families stay in their homes. Economic issues do not operate in a silo, and housing is the foundation that helps protect women and minorities from violence and supports job, economic, and education stability. Secondly, we wholly support the allocation of nearly $50 million to children's mental health. Mental health is chronically underfunded in Nevada, and Clark County is in a state of crisis. Limited funding has led to dangerous conditions for both children and staff at Child Haven, and these funds will help bolster state mental health programs as well as school resources. Shifting hats, I would also like to speak on behalf of AFSCME Retirees. We strongly support the allocation of nearly $2 million to the public benefit public employee benefit program to help COVID testing. Further, I echo the statements of Terry Laird and Kent Irvin, and we look forward to continuing to work with the legislature to return to PEB funding to pre-pandemic levels. Thank you so much for your time this morning. We appreciate the opportunity to speak in public comment.
Thank you. Let's go to the next caller.
Good morning, Chris Daly, Nevada State Education Association, the voice of Nevada educators for over 120 years. Over the last several months, NSEA has testified to this committee and others about the dire educator shortage facing Nevada school districts heading into the school year. Now, with most Nevada students back at school, Nevada still has an unprecedented shortage of educators to teach our kids and make our schools run. Even sadder, very little has been done to substantively address the problem. This past year, we witnessed record educator departures from the state or the profession with low worker morale. Meanwhile, hiring into these vacant positions has proven slow and difficult. NSEA has been tracking vacant positions across Nevada school districts. Most alarming, CCSD still lists over 1,900 vacant positions, nearly as many as were listed a month ago. The issue is not limited to Clark County. Washoe still lists over 350 vacancies, and there are still many vacancies across Nevada's rural counties. Yesterday, the Economic Policy Institute released their report on teacher pay in 2021. They found that the pay gap between teachers and other college-educated professionals reached an all-time high. In Nevada, the gap is 20.4%. NSEA has been calling for bold action to address this crisis, to adequately fund public education in Nevada, and to respect and retain our experienced educators. We've been saying it's time for 20. That means a 20% increase in educator pay and at least $20 an hour for the workers who make our schools run. It also means reaching an average class size of 20 students. This is the right-sized response to our educator shortage and will get educators the pay they need to make ends meet. While you've heard about many important items on today's agenda worthy of your support, including much-needed investment in child mental health, the complete lack of leadership on the educator shortage crisis is galling. In addition to unspent ARPA dollars, this committee heard from the Economic Forum at your June meeting that state revenue is outperforming projections by 25% or close to $800 million. You have the opportunity to seriously address this serious crisis in Nevada right now. Educators and our students need bold action, and Nevada has the resources to make a big impact. It's time for 20. Thank you.
Thank you. Let's go to the next caller.
Good morning, and thank you for your time. My name is Dan Sapp. I have 2 youth with special needs. I want to talk about wait lists. My son experienced long wait lists for services such as to get an evaluation over 6 months, to start ABA therapy was over a year. My daughter has had to wait for services to become available multiple times while in crisis. I'm going to say that again, multiple times while in crisis. Nevada needs the funds to do better for our children and youth. I thank you for your time, and I support your investment in Nevada's children. Thank you.
Thank you. Let's go to the next caller.
If you have just joined or you have not yet provided public comment and wish to do so, please press *9 now to take your place in the queue or raise hand in your Zoom window. Once again, that's *9 now or raise hand in your Zoom window. Caller with the last 3 digits of 111. Please press *6 to unmute. You may begin.
Thank you. Good afternoon, Chair. Okay, hold on. Thank you. Good afternoon, Chair Dennis, Vice Chair Carlton, and Interim Finance Committee. My name is Camila Bywater. I'm the president of the Las Vegas Alliance of Black School Educators and the co-chair for education for the National Action Network Las Vegas chapter. I am calling in support of line item F, regarding the ARPA set request for funding for children's mental health in Clark County. As an educator, I know the importance of supporting our children and ensuring that they have the appropriate mental health and services. Over the past couple of months and during the pandemic, we saw the rise of violence that occurred in many of our schools across the Clark County. And this right here would be a perfect example to support our children and provide them the funding that they need to get the appropriate resources. Thank you so much for taking the time to listen to our public testimony.
Thank you. Let's go to the next caller.
Good morning. My name is Jeff Marin-Setz. We moved to Henderson, Nevada about 3 years ago after retiring from the military. Sorry.
Yes, go ahead.
We have an 11-year-old son with autism. Lost my spot. And other diagnosis. These last 3 years have been a real big struggle to both find the right help and services closer to where we live. For our son's psychiatrist, we have to drive 45 minutes for appointments, as there are limited pediatric psychiatrists available. Our son is also in need of residential treatment center after exhausting all other local resources. And without Nevada, we've gone outside the state, and we've been rejected over 11 times already for residential treatment. As a lot of other callers have noted that it's been a real difficult transition. We're doing the best we can, but also, like the law center said, without local resources, we got to seek elsewhere. During the same period, we've also been reaching out for ABA services and still on wait lists for them. We're also associated with Nevada WIN, PEP. We have a TRICARE case manager, his primary care, developmental pediatrician, therapist. Unfortunately, we can't get to local therapy, so we're Zooming with somebody in Utah. And then I'm doing my best with online searches and Facebook groups to find other resources. We've used mobile crisis in Boys Town in the past, but as time continues without proper services, behaviors are continuing to worsen, and we're running out of choices. Thank you for listening.
Thank you. Let's go to the next caller.
If you have just joined or have not yet given public comment and wish to do so, please press *9 now to take your place in the queue or raise hand in your Zoom window. Once again, that is press *9 now or raise hand in your Zoom window.
Hello, my name is Ariel Loria. I am calling on behalf of a very good family friend of mine. She has a 12-year-old disabled nephew who they have exhausted all their leads, or what little leads they can find in Las Vegas. She's even reaching out for like long-term treatment across the country. She is her and her whole family are definitely in need of some type of financial support to be able to get him the medical care and the treatment that he needs, so that not only he's not harming himself, but harming his family as well. And just looking overall for the best interest for him and his family. And I wanted to say that I have been around and I've witnessed it firsthand, and I've tried to help as well, but he definitely needs more than that, and I'm sure there's a lot of other kids here that need the same thing and are in the similar position that my family friends are. Thank you.
If you have just joined or have not yet given public comment, please press *9 now to take your place in the queue, or press raise hand in your Zoom window. Chair, Your public line is open and working. However, there are no additional callers that wish to give public comment at this time.
Great. Thank you very much. There's been a lot of public comment today, and we appreciate that. A lot of passion, and I know that there are a lot of needs. And so thank you for taking the time to come and speak with us about those needs. So I will go ahead and close this public comment, and we will move to item C. Actually, we're going to do item C and item D. We can do those together, the minutes. Is there anyone that wishes to make any changes or additions to or edits to the minutes?
Would move for approval, Mr. Chair.
Okay. Yes, so we have a motion by Vice Chair Carlton and second by Senator Canizaro to approve the minutes as is. Is there any discussion here in Carson City? Anyone down in Las Vegas? Any questions or online? Okay, I'm not hearing any. All those in favor, raise your hand, say aye. Aye.
Aye.
Any opposed, say nay, or raise your hand. Okay, so the motion carries. We've approved the minutes for item C, on item C and D, the April 7th minutes and the May 5th meeting minutes. Okay, so what I plan to do now is we're going to go through any of the ones that we would like to pull out on items E. I'm sorry. No, we're going to have that statement first. Let's thank you very much. That's why I appreciate staff so much. Let's do the item number E, Statement of American Rescue Plan Act, Coronavirus State Fiscal Recovery Fund obligations and remaining reserve balances. So I believe that we have Mr. Leiser. Is that correct? Yeah, so Mr. Leiser, if you would take that item. Thank you.
Thank you, Chair Dennis, Vice Chair Carlton, members of the Interim Finance Committee. For the record, Brody Leiser with the Fiscal Analysis Division, Legislative Counsel Bureau. I will walk through agenda item E, the Statement of American Rescue Plan Act, Coronavirus State Fiscal Recovery Fund obligations and remaining reserve balances. The statement can be found in volume 1 of the meeting packet, beginning with a summary sheet on page 179. If all items submitted for consideration today are approved, which total approximately $249 million, the remaining unobligated balance of coronavirus state fiscal recovery funds would be approximately $847 million, as displayed toward the bottom of the summary sheet. Of that amount, when accounting for the $250 million reserved for the Home Means Nevada initiative, the remaining unobligated balance is approximately $597 million. Pages 180 through 184 of the meeting packet detail the obligations approved to date. There are 57 work programs submitted for consideration by the committee, which began on page 185 of the packet, that, as previously mentioned, would obligate approximately $249 million in funding authority. I was going to walk through some of the larger requests before the committee today. However, they were generally covered during the public comment period. So I'll skip through those and move on to pages 187 through 191 of the meeting packet. This represents the breakdown statement for select obligations of coronavirus state fiscal recovery funds. There are 4 items on page 190 under the section for allocations of the $100 million in authority for state agencies that were approved by the governor's office and did not require approval of the IFC as indicated on the statement. These 4 items are on the list with the dates of July 21st and July 22nd, 2022. On page 191, I need to make note of a revision that was received after the statement was finalized for the meeting packet. This revision will be noted again for the members when items from the work program lists are discussed. Agenda item F30 was revised by the Governor's Finance Office to reduce the request from $1,581,115 to $1,462,644 with no change in purpose. If approved today, the statement that is presented to the next meeting of the IFC will reflect the reduced amount. And Chair Dennis, that concludes my remarks on the statement.
Thank you very much. This is an informational item only, but is there any questions from the members? Not seeing any hands here. How about down in Las Vegas or online? Not hearing any. All right, so with that, we will move then to item, before we do, we're going to do items F, G, and I believe P to see if there's any items that you wish to pull out. I'm going to have staff go through the ones that we've identified, and then I have some additional ones that have been shared with me from the members, and then I will ask to see if there's any additional ones after that. So let's do that first. So, Mr. Thorley, would you go over those items that we've identified?
Thank you, Mr. Chair. So I'll begin with list F, starting with F1, then F2 and 3 will be heard together. F4 and 5 will be heard together. Then F6 and 7 will be together. Moving on, F12, 15, 16, and agenda item K will all be heard together. Again, that's 12, 15, 16, and K. Moving on, there's a large batch of work programs that will be heard together, beginning with F17, 18, 19, plus F31, plus F36 all the way through F53. So F17 through 19, F31, and then F36 through F53. There is a revision for F30 that Mr. Leiser just noted. This is the Department of Health and Human Services, Public and Behavioral Health Facility for the Mental Offender. Again, the revision there, this revision was received after the agenda was posted. But the change is, and there was already a previous revision received, so you'll see that revision reflected on the list, but there's an additional revision, so it's no longer a request for 1.58 million. It is a request for 1,462,644. So 1,462,644. The last items on list F that have been identified to be pulled for discussion are 55, 56, and 57, and they will all be heard together. Again, that's 55, 56, and 57. And those are all the items on list F. So I'll move on to list G. Starting with G12. We did receive a withdrawal request for G26 that was received after the agenda had been posted. So it's not reflected on the list, but G26 has been withdrawn. We also received a withdrawal request for G42 after the agenda and lists were posted, so it's not reflected on your materials, but G42 has been withdrawn. G43 will be pulled for a discussion. We received a revision for 49 and 50, again, after the agenda was posted. These are companion work programs that transfer general fund appropriations between fiscal year 22 and 23. The amount of the transfer has been revised from the $44,000 that's in your materials. It is now $5,299, 5299. So that change would be in effect for both 49 and 50. 51 will be heard jointly with 64, so G51 and G64. We received another withdrawal request after the agenda was posted for G90. Department of Public Safety, Highway Patrol Division. So G90 has been withdrawn. Another withdrawal request received after the agenda was posted for G109, Department of Wildlife Habitat Division. So that's 109 that has been withdrawn. G112 and 113 will be polled and heard together. G114 has been withdrawn. That's also not reflected on your materials. The withdrawal request was received after the agenda was posted. So again, that's G114 that has been withdrawn. And then lastly, on list G, 122 and 123 from Healthcare Financing and Policy. Both those will be pulled for discussion and heard jointly, and the agency has a revision that they would like to request for both those work programs. But those will be pulled and the agency can present their revision at the table. And that's it for list G. And then on list P, which is the informational items list, there's one item that has been identified to be pulled for discussion. That is P1B, Office of Project Management, Smart 21.
Okay. Let me see. Let me get my notes here because I've got. Okay. In addition to those, I did receive a request to pull F9. If we didn't already, let me make sure. Okay, F9. And I didn't write down who, so when we get to that, just remind me. Also F11. F23, F36, that's already, okay, that one, F36 has already been pulled? I didn't have that. Okay. Also, let's see, 32. Did I do that one? Okay, F32, F54. I didn't think we had pulled that one, so F54. And additionally, that was on the F. Then on G, I'm sorry, go ahead. And any other additional ones on, while we're at it, any additional ones on F?
Mr. Chair?
Yes.
Just
Titus.
Thank you. I had asked for the F11, but F10 is tied to that, so they both really need to be pulled if we're going to pull F11. Thank you.
Okay, so that would be F10. Can you get that? So 10 and 11.
And Chair.
And then I believe that F8 is probably the companion to F9, so pull that. I'll come to just a second here, and I'll come. I can't remember. I don't know who did that, but I will be right back. Anybody? Any other ones here? Okay, I believe was that somebody that was online?
Yes, Chair.
Oh, yeah. Some movement tolls. Yes, please.
Yes, thank you. And I appreciate you acknowledging F36. I also wanted to pull F44 and F45.
Those are already pulled. So, yeah, 36 through 53 are already pulled. So anything that between 36 and 53 are already getting pulled.
But we were going to hear that as a group. So do I just wait till we hear that as a group and then ask questions about those specific items?
Yep.
Okay. Thank you.
Yeah, because we were going to do all of those as a big group because they're all related. All right. Anything else? Any other questions on F? Okay. Let's go to on G, items G. I have been asked to pull G37. The Governor's Office of Economic Development, Rural Community Development. Also, G46. FEMA, yep. Hold on, I'll come back. Okay. Let's see, 20 and 21. So 20 and 21, the public charter school. And let's see, 46, 62. 62. G, that was G62. Okay, those are the ones that have requested. Any additional ones that I have missed? I don't see anybody here. Also in Las Vegas, anyone wishing to pull any? Or online? I believe Senator Neal had 20 and 21. Yep. Okay. And how about on P? Anybody wishing to pull any additional items off of P? Okay. I'm not hearing any. So we're going to pause for just a second because that was a lot. And I want to make sure that when we do the approval of the ones that we get it. So hold on just 1 second. We'll be in a brief pause. Okay, I think we got it now. So I'm going to have staff go over the list of the ones that we have pulled, and then I'm going to take a motion from my vice chair so let's go that far. So let's have you read the ones that we pulled.
Thank you, Mr. Chair. So these are the items that have been identified to be pulled for discussion, and I will begin with list F. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 15, 16, 17, 18, 19, 23, 31, 32, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, and 57.
Okay, hope everybody's taking notes. I'm going to just pick one of you randomly to repeat that. No, I'm just kidding. Okay, so that's
most of them.
Yeah, that's most of them. Okay, so let's go to G, item G.
On list G, the items that have been identified to be pulled for discussion are 12, 20, 21, 37, 43, 46, 51, 62, 64, 112, 113, 122, and 123.
Okay.
And then list
item
P is 1B.
1B on P. All right, so I'm going to take a motion from my Vice Chair Carlton.
Thank you, Mr. Chairman, for the honor. I would like to move that all items not pulled by staff and items with noted, okay, wait a minute. And items that have had noted revisions by the staff be processed at this time.
Okay, so, and we have a second by Senator Cannizzaro. So the motion included any of the revisions and that were made on the ones that we aren't going to pull. All right. Did we get that right? Okay. Any questions on the motion? Yes.
Yeah, thank you. And I appreciate that everybody wants to make this go as quickly as possible because we've pulled so many, but I think for the record, we really do need to put the numbers on the record of what ones we're voting for, which ones we are consenting to vote for.
Are you talking about to actually list the ones that we're approving right now?
Just by the number, I think we should say we are voting on these numbers because I think there's very few of them in E that are, or F that are left. I want to make sure that we've clarified which ones we are voting for.
Okay. Hold on once. I'm going to pause.
Because it's the reverse. Usually we only have a few.
Yeah, I understand the thing. Let me just make sure that we can do that real quick. So hold on, and we're going to pause for just a second. So normally we don't have as many. So what I think what we need to do is do the ones for F because we pulled a lot of F, and then on the G, I think we know which ones those are and the other ones. So if I'll have Mr. Thorley just do the ones in F that we actually are approving at this time.
Right. Thank you, Chair.
And then on G, the ones that we have already pulled, we're assuming that all the other ones are being approved. Yes. So, right, you're correct. We do have a motion, but we are clarifying what the motion is, and so I'm going to, on the item for F, we're just going to clarify which ones we actually are doing, which I think is appropriate at this part in the motion. So.
Thank you, Mr. Chair. So for the motion, for clarification on list F, the motion includes 13, 14, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30 with the noted revision, 33, 34, and 35.
Okay, just so you're clear, those are the ones that we are actually voting to approve right now, along with the other ones. All right, any other questions or clarifications? All right, all those in favor, say aye and raise your hand.
Aye.
Any opposed, say nay. Okay, so those are approved. All right, let's see. And I'm going to make a change here. First of all, I've had a request, I believe. Let me just double check. Before we move on, I've been asked by Senator Settlemyer if he would like to make a statement before we move on with the rest of these, and then I'm going to, and just so that you know, I'll have him make his statement. It is my intent, if I can find my notes. Where's it's these, the 17, 19, 31, 36, 53. Okay. All right. So after that statement, and I guess any other statements that members would like to make at that point, it is my intent to take lunch in a few minutes. Let's see. All right. Okay, so here's what we're gonna do. We're gonna take the statements, and then I'm gonna do items number 17 through 19, 31, 36 through 53, which I believe are all the mental health ones. I know that there's a lot of people here for a lot of different ones, but I want to take that one, and then after that we will take lunch. Just to give you a heads up for those of you that are in the audience here or online or whatever, or in Las Vegas. Senator Settlemyer.
Thank you, Mr. Chairman. My concept is there's a lot of items here dealing with the ARA funds that I figured that if I just made one general statement that applied to everything here today, I would not have to make it on each item, and just in order to try to speed up this process. In that respect, I am very supportive of trying to do everything we can within mental health and all these other subjects. I extremely appreciate, and we'd all discussed during session, that all these type of funds should be used for one-shots, and I'm completely supportive of that. I may be voting no on some of the individual ones, though, due to the fact that if it includes staff that is ongoing, that we're creating a budgetary hole for the future that we should have dealt with last session. And I've always been a fan, or I've always indicated I would have preferred to see more money spent in mental health, even if that had to come out of education, just because simply it solves problems for the future. I just wanted to put that statement on the record for now, and that way I don't have to make it on every item. Thank you.
Okay, anyone else wishing to make comments? I do appreciate anything we can do to save time today. The other thing that I am going to ask also, I know in some of these, we probably need a presentation on some of these just so we understand the issue, but for the most part, I want to try to just go straight to the questions that we have. And I believe on this first one that we're going to go, that we can actually probably just go straight to our questions. Is that right? Well, actually, if someone wants to come up and give a real quick 30-second, we'll kind of set it up, and then we'll go straight to the questions.
Good morning. For the record,
Dr. Cindy Pitlock. I serve as the administrator of the Division of Child and Family Services. I'm going to have some brief opening remarks, and then we'll just roll right into questions. Good morning, members of the committee, Chair Dennis and Vice Chair Carlton. Joining me also today is Dr. Jackie Wade, Deputy Administrator over Community Services, Dr. Stephanie Woodard, DHS Senior Advisor on Behavioral Health, and several other subject matter experts from other entities and counties. Children and youth have experienced unique negative effects of the COVID-19 pandemic due to isolation, loneliness, school closure, and disrupted relationships with caregiving adults. This highly vulnerable population has been hit hard by the pandemic-related stressors during critical periods in social, emotional, cognitive, and neurological development. 1 out of every 316 Nevada children have lost a parent or caregiver to COVID-19. Since the onset of the pandemic, many children have developed symptoms of depression, anxiety, or behavior health disorders, and those already suffering have experienced severe exacerbation of symptoms. I won't go into any statistics because I think we are all quite aware of those. This combined package represents a huge effort of a team of stakeholders, of which many are here today. A collaborative group has been meeting, planning, and researching to determine the most impactful way to respond to Nevada's children during the time of crisis. I am forever grateful for their support, passion, commitment, and mentorship. Relative to the saying, "It takes a village," we brought you a village. This request seeks to further build out and strengthen a currently very insufficient children's system of care. In doing so, new services will be brought to Nevada that would allow more youth and families to fully participate in services in their home and communities, and conversely, provide greater access to inpatient and residential services when home and community services are not medically appropriate. It will also serve to improve opportunities for smooth transition back to home and community services after an inpatient or residential admission, and will reduce the risk of recidivism in absence of these services. Additionally, in other states that have implemented a comprehensive system of care approach, significant cost avoidance and return on investment has been realized. These components represent the essential services, supports, and infrastructure within a robust and complete system of care. Each of these components work as part of the whole system and work together to create an interwoven system of services and supports rather than a menu of choices and options. The entire system must work in concert, so that youth may move up and down the continuum as needed. Also, infrastructure must be present to monitor and manage the system as a whole, provide training and technical assistance, ensure quality and fidelity, and for ongoing data gathering and evaluation. Sustainability plans for these programs will include exploration of braided and blended funding sources, working with Nevada's Medicaid program for possible plan amendments or waivers, engaging the impact of these programs on youth and families through data collection and quality review. Also, through the transparent budget process, future legislative cohorts may decide collectively on feasibility and necessity of continuation. I also have both Clark and Washoe County here with me for any opening statements if you would like from them. And I have my team here also to answer any questions you may have.
I'd be glad to hear from Clark and Washoe if you have a quick or
sure.
Any of the ones that have quick
Sure.
statements.
Clark and Washoe are prepared with some opening comments as well.
Go ahead.
While they come up, Chair Bailey Bordelin, Deputy Chief of Staff for the Governor. Very quickly, I just wanted to put his thanks on the record for this team, the wide variety of stakeholders and all of the folks you've heard from today and the community members that we've received input from. This has been difficult work to do during the pandemic. We have had an incredible team that can answer all of your questions on sustainability, and the governor is committed to making a significant investment in children's mental health in the GovRec budget because we have a moral imperative to continue this work, and we would not create fiscal cliffs from these items. So I wanted to put that on the record. Thank you.
Thank you very much. Go ahead.
Good morning, Mr. Chair, members of the committee. Tim Birch, Human Services Administrator for Clark County, Nevada.
We'll keep it brief and just echo the themes you heard in public comment. We've all sat through long public session comments for the last few years, usually railing against things we're doing. It was nice to hear this level of support for the things that we want to do to help families. You also heard about the gap in the system of care that is present in Nevada, and how that gap feels like a canyon when these families are standing on the ledge of not being able to receive services. That ledge and that canyon becomes an endless hole once children fall into a child welfare system that is not engineered or designed specifically to receive them solely because they cannot receive mental health services in our community. Over almost 100 families in the last 12 months have fallen off that cliff. They've come to a point where they've said, we can no longer deal with these challenges. I will take abandonment charges just to try, out of desperation, to get my children help. That is not the system that we want for our children. And these changes that we're proposing today, and we're asking for your support on, rectify and build a bridge over that canyon for our families. So we look forward to your support, and we're present for any questions you may have.
For the record, Kevin Schiller, Deputy County Manager, Clark County. I'm not going to repeat what Mr. Birch said, but Chair and Vice Chair and members of the committee, take it to a different level. You've had lots of personal testimony today. I think one of the pieces I would really echo is the continuum of care when we use that terminology and we talk about where people enter the system. You heard a lot about people entering the system at the highest level. And a lot of what's happened over the past year, I want to compliment your staff. I want to compliment DHHS. I have never seen a stakeholder group in 25 years like this group. And when I say the front door enters at different levels, if we can get to the lower levels, if we can create diversion and create these services, which is what a lot of this is about, it also reduces the cost at the higher level and reduces that ultimate end outcome, which can be, you heard it today, suicide, death. Massive depression. So from the manager's office side in Clark County, we are very supportive of this. I do want to compliment the collaboration, and we're happy to answer any questions because I believe this is literally precedent setting in terms of where we can move. And I also want to address the sustainability discussion. From a Clark County perspective, the buck stops here from the perspective of when somebody shows up at Child Haven or whether they show up at social service. So we don't get to say no. We have to figure out that continuum, and that sustainability is tied to all the funding pieces that you've heard. Medicaid is a big piece of that, but the county is also contributing significantly, and we want to ensure that we can maximize how we reimburse so that we don't create something that we're back in a year asking for you to say, here we go again. We want to make sure this is sustainable, and that's been a large part of why this has taken a year. Thank you.
Good afternoon, Chair, members of the committee. My name is Ryan Gustafson, Division Director with Washoe County Human Services Agency Child Welfare. And just to sort of speak specifically to some of the issues at Washoe County, certainly we're seeing the same things in Washoe as being seen in Clark County and the rest of the state as well. We have certainly, we've spent several sessions working with you and working with our system partners trying to get in front of this problem, right? Trying to do preventative things, starting mobile crisis, starting a lot of in-home services. And COVID certainly has put a significant dent in that. And in Washoe specifically, we lost one of our acute psychiatric hospitals, of which we only have 2. So we lost nearly 100 beds. We lost an early childhood program. We lost a program that that worked with boys who, young men who had been adjudicated of sex offenses. And so we've seen all of these programs that really ran the gamut of mental health get closed down. And that was really exacerbated the issues that we had with the lack of psychiatric services. Just some sort of alarming statistics is that we've now seen, in the last year, we've seen a 300% increase in emergency shelter bed days for children. We were down into actually the single digits in Washoe County, and we had maintained that for about 18 months. And then COVID hit, and then we lost a lot of our mental health service providers who we've been working with, and our director, Amber Howell, has been working with other service providers to try to really get that reintegrated in our community, but it's certainly been an uphill challenge. So we've seen emergency care increase. We've sort of re-bottlenecked the hospitals with kids who are going into medical facilities while they wait for beds, and we had sort of worked on undoing that problem with the mobile crisis program, but that problem has certainly reemerged at this point, and there just is, it's not just mental health services, there's not beds for kids. I know we're looking at foster care rates and other things that have not been touched in over a decade. So I think what we are discussing today is of the utmost importance for kids. Child welfare and children's mental health certainly go very much hand in hand. And so I just really thank this committee for the work that you guys are prepared to do.
Mr. Chair?
Yes. Senator, go ahead.
Yes, thank you. Thank you, Mr. Chair. And I guess I've just got one thought that continues to go through my mind, and we're appropriating a ton of money, but how is that going to translate into personnel? I don't care what industry you're in. You know, we can't find the providers. We can't find truck drivers, let alone psychiatrists and especially healthcare providers. You know, it's just, we've got a huge void. Are these dollars going to be able to get to the ground because we don't have that personnel?
For the record, Dr. Pitlock, thank you for the question, and that is something that is on all of our radar, right? We're talking about standing up programs for millions of dollars and wanting to impact thousands of families, but we need people to actually perform those services. So in a parallel process, of course, we're all working together for a robust array of expansion of the workforce, and what that looks like. We are working with our partners at the universities, the community colleges. We have some other issues or other items on this agenda that we're feeding into our own workforce by bringing students in, paying them what would be the equivalent of a stipend if they were to do this at a private entity. And really give them the clinical hours, boots on the ground they need to feed into our workforce. So it's a really huge process of pulling workers into Nevada, making Nevada a great place to live and work, make businesses want to come to Nevada to provide these mental health services and bring employees with them. We know that DCFS, DHHS is not going to be able to stand up all of these programs and provide these services ourselves, right? We need to lean in to our community partners and partner with them, bring them in, provide them a great place to live and work, and provide these services for Nevada's youth.
Thank you, and I think, you know, after 3 hours of public comment here, we have, at least those people that commented need to understand this response isn't going to be quick. It's going to be a long, drawn-out process. It's going to take years to build this. So thank you, and thank you, Mr. Chair.
Thank you. So, did we finish the presentations?
Hi, Kara Pally. I'm one of the division directors with Washoe County, and I just want to reiterate how important it is for us to work together with our state partners, for them to have the staff to get the job done. Our emergency shelters, like Mr. Gustafson said, are just exploding, and part of that is because there are no mental health beds. And the other piece to that is we have 3-year-olds with adult or almost adult kids that are all together, and it's not an ideal setting. And our staff there is committed to keeping them safe, and it's just not what we want to see for our kids and families. On the other side, we have kids that are aging out of care that really need the support as well. And public and behavioral health doesn't always have the staff available and resources available for them as well. So we're getting bottlenecked on both sides. And just my final statement is with AB 387 and really trying to help families keep their kids out of child welfare. We really need to invest in that, and I know the state is trying, and their hiring crisis and retention crisis is keeping that from happening, and we're seeing families suffer. So thank you for your time today.
Okay, we've got Vice Chair Carlton.
Thank you, Mr. Chairman. So since some statements were made earlier, I just think I need to kind of preface a lot of this. Children's mental health is in crisis in this state. It has been for a while. We've tried to address it piece by piece, I remember the first autism bill I signed on to. I was still in the Senate for former Assemblyman James Orenshaw, now Senator Orenshaw. We've tried to address different components of this over the years. We now have an opportunity to make generational change in the state for children's mental health. And I believe we need to take this opportunity right now. And Senator Gokachio is exactly right. It's going to take years to build. We can't wait a year to start. We need to start now. We have an opportunity. These folks have gotten together for over a year to come up with a plan to move forward on children's mental health. We cannot delay. We need to take action now. I appreciate Ms. Bordelland's comment about not building a fiscal cliff. She and I have had many, many conversations about we have to be careful what we do. But here's the thing. I know the governor's folks have committed to children's mental health in this state, and I know that as the budget building process progresses over the next couple of months, children's mental health is going to be at the top of their list. So I won't be here, but I don't have any concerns that there will be a way to address this moving forward, because we have to take care of these children and families. I know there's been some sustainability comments, and I guess the one that comes to my mind the most is the Medicaid rates and how we're going to address the Medicaid rates going forward to make sure that we can get the providers, because providers bail on us if Medicaid rate isn't high enough, and we can get more providers if we do it the right way, and we can serve more children. So if someone could just address that Medicaid component in this whole conversation, I think it would pretty much put a ribbon and a bow on it for me. Thank you very much.
For the record, Dr. Pitlock, thank you very much for that comment, Vice Chair Carlton. We do have our Medicaid colleagues that are ready and willing to speak to that. I believe Dr. Antonina Capurro is with us today. Dr. Capurro?
Yes, thank you, Dr. Pitlock. And what I can speak to
Make sure you identify yourself for the record before you start speaking. Thank you.
Yes, thank you. For the record, I'm Dr. Antonina Capurro, Deputy Administrator with the Division of Healthcare Financing and Policy. And we have been working with our stakeholders to sustain these projects that have been identified for funding today. Earlier this year, we came before this body with a request to use federal Title 19 grant funds and home and community-based service reinvestment funds to procure a consultant to research and recommend strategies to enhance Medicaid-funded children's behavioral health services. So we are currently working with health management associates to identify long-term strategies to help support the projects that are before you today. And so we are very carefully and methodically going through those to identify service delivery models, any needed Medicaid authority or federal approval that might be needed to sustain those projects. In addition, we also have the Mobile Crisis Planning Grant. Nevada was one of the states that won that funding. So we have enhanced FMAP that will come along with that, and we are working with our stakeholders and partners to build that continuum of care. If there are additional questions, I would be happy to answer them.
Yeah, I think Assemblyman Carlton has some additional.
And thank you, Mr. Chairman. And I made the statement that I'm sure that this is going to move forward, but I guess I need to have either Ms. Bordelland or someone from the division come forward and talk about how these things will be addressed in the upcoming budget conversations.
Good morning. My name is Katrina Nielsen. Thank you for the question. So we are anticipating preliminarily that the cost to continue these services that are before you today would be approximately $28 million. 18.6 of that would be Medicaid funded, or 66%, and 34% would be funded with general fund, or $9.4 million. I'd be happy to answer any other questions.
And this will be a budget enhancement or included in the 2023 budget cycle, is my understanding.
Thank you, Katrina Nielsen, for the record. Yes, this currently what our plan is the funding before you is for fiscal year 23. We will submit a enhancement request for the funding to ARPA funding will end in fiscal year '24, and then in fiscal year '25, we will come forward with our new funding streams to reinstate the positions and the services that are being approved today.
Thank you very much. It's good to have all that on the record. Thank you, Mr. Chair.
All right. Yes. Samum Titus.
Thank you, Mr. Chair, for the question, and thank you all. And again, we all heard the testimony today, and as a physician, certainly it's been difficult referring patients for those services. And as someone who works with the Lyon County School District, we know that these difficulties with our mental health, and I'm also on our behavioral health board here, and so we hear this all the time. And again, I have huge concerns similar to what Senator Gocochea asked. And I have to throw out here, these are 46 new positions for the state. And somebody correct me if I'm wrong, but do we not currently have anywhere between 25% and 33% vacancies throughout the state of Nevada on all departments? And I'm wondering if this is really... this all sounds great on paper, but and how does it come to fruition? And then we're bad if we don't support it. But I'm very concerned that this is a huge expansion without. It looks great on paper, but finding the personnel to do this, and then if we as Medicaid providers don't accept this, as Vice Chair Carlton put out, then we're the bad people because then we'll abandon it because we as providers aren't seeing these patients. But there's no guarantee in here that there's going to be enough incentive. Why would we see them if we lose monies every time we see a Medicaid patient, and then takes us away from those who are reimbursing us? And so then the providers are the bad people. And so I'm just concerned that you're setting folks up with this expansion without telling me how you're really going to fulfill it. So I've asked a lot of questions there, but I first want to know, how many open positions do your department have right now?
For the record, Dr. Pitlock, thank you for the question. So we have, I could get the exact number of vacant positions we have now, but yes, I acknowledge that we have anywhere from a 22 to 50% vacancy rate, depending on which seat you're sitting in at the time and what program you're looking at. And I can certainly return with the exact number of vacant positions and what those consist of. What I would highlight for you, Dr. Titus, is that what we're bringing to Nevada are new programs, brand new programs that we've never been able to offer in Nevada before. And with that, those programs need fidelity oversight, fiscal oversight, programmatic oversight to make sure that the funds that we're investing into Nevada's youth and families are being expended in a way that has outcomes that we know are predictable because we're standing up evidence-based programs. So yes, we are bringing brand new programs into the state. Those programs need oversight and accountability and fidelity. If we were to utilize some of the vacant positions we have for those programs, we would be taking away from existing programs that are already completely taxed and short-staffed and are frankly not operating well as it is. I hope that provides a little bit of clarity.
It actually more concerned because we still have those vacancies, and are you going to be, you can't perform the job you're trying to do now with the current vacancies, but yet you're taking on the task of all new programs. And so that's even a greater concern to me because the programs you have can't function efficiently now because of lack of staffing. Thank you.
Who was that? I can't see. Oh, Senator Stoudemire, and then we'll go to Assemblywoman Hanson.
Thank you, Mr. Chairman. I appreciate it. I was kind of curious. I'm getting a lot of text after my comments, and I was wondering if you could elaborate. I'm getting some discussion from different people, again, through media, that sometimes these new positions aren't necessarily new, meaning that a lot of times they'll be utilized to take people from part-time status to full-time status because then we'll actually have the adequate amount of funding to do so. So maybe it's not as problematic as I'm thinking. Also, within that respect, funding of ones that unfortunately, due to last session's budget where we cut stuff where we should not have, maybe it's actually going to be able to fund those positions that, again, existed before but were cut in last year's budget. Of those 46 positions, do you have any just off the top of your head, percentage-wise, which ones might fall into that category? Into the categorization of the concept of ones where you're going to be able to take people that are only working minimally now due to budgetary concerns, going from part-time to full-time, and ones that, unfortunately, we had cut in previous budgets, due to economic reasons that now we'll be able to fund full. I was just kind of curious if any of these 46 kind of fit into that.
Thank you for the question. Katrina Nielsen for the record. The positions that we're asking for are all new positions. These are not positions that were restored with ARPA funding from last biennium. The positions that were restored last biennium with ARPA funding were for the juvenile justice facilities, and these are for children's mental health.
Thank you, Mr. Chair.
Thank you. Assemblyman Hansen.
Thank you, Mr. Chair. And thank you for being here. Thank you for the work you do. As the newbie, as an alternate today, I feel extremely humbled. I felt very similar how I felt during the COVID session when we were in a budget crisis. So I come to this meeting today with a lot of humility about the amounts of money we're dealing with and the kind of services that we need to provide. In 2019, my first session, I left here absolutely convinced about one thing, and that yes, we are in a mental health crisis in our state, and particularly how our youth are affected. So as I'm listening and trying to grasp this all, yes, there's this need. I share some of the same concerns with my colleagues. Where will this money reside? If you're not able to staff, but you've been allocated the money, where will it reside if this is going to take a few years? I just kind of want to understand where that, and who has that oversight over those funds.
For the record, Dr. Pitlock, thank you, Assemblywoman Hansen. So some of these monies will be passed through to other entities. Some we are planning on contracting out and bringing those services in, leaning in on community providers as contractors to provide them, and some we will be standing up within DCFS. DCFS will be the ultimate oversight authority of those funds and programs. I hope that answers the question. If not, I can clarify a little more.
Thank you. That helps. And I'm probably going to really expose my ignorance in these matters. I mean, I own a business, so I'm not unfamiliar with fiscal issues, but not on this scale and not with a bureaucracy. So if you have all these funds, but you're not utilizing them all, do we have a guarantee that they're going to be preserved? They're not going to be used in some other way? Then as you grow your staffing, will the monies be there for that? And if I could just piggyback, Chair, I'm sorry, an additional question I just thought of. Would that be okay?
Yeah, go ahead.
Is the staffing issue, and we face this in education, is the staffing issue we're not paying enough in wages, or I'm assuming we just don't have the qualified because of what my daughter's a licensed mental health professional in the state. I know what those requirements are, and they're quite a heavy lift. Is that the problem? We don't have enough that are qualified, or is it just we don't pay enough?
For the record, Dr. Pitlock, thank you, Assemblywoman Hansen. I'll break that out into two separate topics for us. The first was the funds. Where do the funds go? How do we know how they're being spent? How will that be overseen? I think Katrina Nielsen would be able to tell you the funding streams that we have set up and how that will be accounted for. And after that, we can talk about the actual workforce development piece.
Thank you, Katrina Nielsen, for the record. In answer to your question about how we're going to keep the funding separate,
Hold on 1 second, just because this isn't different than any other department on how they handle that. And so I know that our staff can actually probably help you understand that part of it, because I know this is like your first opportunity at this. And so I'm trying, and in order to try to speed us up a little bit, I'm going to ask that you get with staff and just ask them how do we handle this as we move forward with the funding stream, because it's going to be the same for every department on how we do this as we move forward. So, and then go ahead and answer the other part of the question.
So Stephanie Woodard, for the record, I'll address the second part of the question, which is workforce. We have endeavored across the department to continuously study why we have such high vacancy rates, the kinds of positions that are occupying those high vacancy rates. What we have seen, especially during the pandemic, is a difficult time maintaining a lot of our clinical staff. You can imagine that the rates that we're able to pay our clinical staff are a lot less than what we've seen as an increasing market demand for especially positions like nurses. So I think it is important to differentiate the kinds of positions that we are struggling to be able to fill. And I imagine Dr. Pitlock can provide some very granular information on where those vacancies are currently within the Division of Child and Family Services. And then it also does have to do with the workforce, the available workforce that we have in our state. And something that I think has been brought before this body for many, many years is how do we rectify the need for additional workforce. What I would say as it relates to the children's system of care and the services that are in the package before you this morning is that we have an opportunity now to also diversify the kinds of services that are available within the community. So not all of these services would be considered traditional clinical services. In here you have emergency and planned respite, for example. Those are not necessarily licensed behavioral health providers that we would need to be able to pull from in existing areas of our workforce to be able to provide these services. In addition to that, it's wraparound. So we're talking about case management and care coordination. And so what we see in other states that have done this before is we're actually broadening the amount of eligible workforce that we have to be able to provide these critical services, which then allow some of our very finite resources for our clinicians, our licensed providers, to actually be able to work to the top of their scope and not also simultaneously have to try to be all things to all people that they're serving. So ultimately, we anticipate that services that are represented in this package today will actually help to alleviate some of the pressures that we have on our formal behavioral health system and be able to add complementary services.
Thank you. I appreciate that, and I'll look forward to getting offline with the staff. So thank you for your patience with the alternate today. Thank you.
Thank you. And one other comment I will make, the comments that they just made about having a hard time hiring, we could ask every department in the state and the answer would almost be the same, that we don't pay enough, that we don't, all those things that we just went through. We have the same issues, whether it's IT, whether it's police, whether it's, all of those kinds of things. So, we are going to go to Senator Neal.
Thank you, Chair Dennis. I had a question. It's from F19. I wanted to dig more into the care coordination. I'm on page 19.2 of the backup, where the school district will be a part of this relationship and trying to build supports. One of the expected benefits that was listed was that this program would be supportive to school staff and educators. And I'm just wondering how you guys are going to do the care coordination. I know it's a real need, and I know that parents are experiencing this, and you can have a teacher in a classroom with a child that may be severe ADHD, and they just don't know what to do or how to manage it. So I'm wondering what this coordination will look like.
For the record, Dr. Pitlock, thank you. So I see we're blending a few issues here, and I want to make sure that there's some clarity. So if you're talking about 19, you're talking about the Mobile Crisis Response Team outreach and support to both Clark County schools and Washoe County schools. If you're referring to care coordination, we're talking about the wraparound program. So I just want to clarify which you're trying to speak to.
I was addressing the mobile crisis, but in my mind, I treated, if you're going mobile crisis to a school, that is care coordination. So if you guys have delineated it differently, I will apologize for that, but that's where I was going.
Of course, Dr. Pitlock, for the record. So mobile crisis is going to be working directly with both Clark and Washoe County schools, and we have representatives from the Department of Education here to also add support and comments if necessary, to really stand shoulder to shoulder with the school districts with the resource officers, the embedded mental health services there to provide a more robust and comprehensive response. This is an excellent opportunity for us to partner with the school districts to provide that kind of a response in a clinically appropriate way. The mobile crisis response teams are trained in emergency response for youth and are happy to step up with the school district to partner. And I can certainly bump that to our Department of Ed people that are here as well, that have been working with us over the last 6 months or so on the program.
Chair Dennis, I'm okay. I mean, I can ask them offline.
Perfect. Great. Thank you. Let's go to Assemblywoman Benitez Thompson.
Thank you. Thank you so much, Chair. I just, as I look through all of the work programs, just want to speak to how comprehensive this is and how big it is. And just in my legislative experience, we, in the course of like one session, might get to do one or two of these things. We're like, oh, look, we gave a little chunk of money to mobile crisis. Yay. Oh, we've given a little chunk of money to respite services and foster care. Oh, you know, but never in this way, this kind of package, kind of soup to nuts, schools, in-home, out-of-home respite. China Springs is in there, rural, urban, interns, north and south, to help with the pipeline, the systems of cares that you're setting up, clinical, all different types of licensing types and unlicensed, peer in there, and then the Medicaid billing resources. I mean, this is just really soup to nuts. If you could set up and say, we're going to set up and really design a system to care for children from crisis through treatment, stabilization, and pay for it, you've covered a lot, and it's something that is almost a gift in a way, because we've never been able to tackle it like this before. And so this work is, this is a big deal, and it really is something that I think is reflective of the Can Do Nevada spirit, that to step up, to organize this, to have everyone considered at the table, and to say we all got a piece of this and we're all going to make it work. So just hats off.
Thank you. Do we have any other questions or comments? Down in Las Vegas, anyone? Oh, Senator Harris.
Thank you so much, Chair Dennis. No questions, just a very brief comment. I'd like to note that my vote today is not just in support of the programs, but also represents my commitment, to the extent I have the ability to ensure that these programs are ongoing. And I ask my colleagues to join me in making that commitment today. I see no reason to wait when we have these programs in front of us. So thank you all so much.
Thank you, Senator Canizaro.
Thank you, Mr. Chair. And I first just want to say that I have to commend the work that we've heard today, because I don't think this is just a request from an agency for some additional positions that cannot be filled, or a Band-Aid sort of fix. That this is really a comprehensive group of individuals that we've heard from the counties, we've heard from everybody who is sitting here at this table. Thank you to Speaker Buckley for being so involved in these efforts, because I think that, to Assemblywoman Benitez Thompson's point, we are seeing something that is very comprehensive, and so that gives me a lot of confidence in voting for this. I also am hearing that this is both a runway to help create positions where we do not currently offer services, and also to build in supports where we're working within the other pieces that exist here in Nevada to help grow professionals to take on these roles, which also gives me a lot of confidence in the fact that we are in part of this, funding some personnel within these departments and divisions, and for crisis teams working with the schools, and so on and so forth. So for me, that, I think there's a lot of value in that, and that we're not just sitting here saying, well, let's just give a couple more positions to the department, they'll figure out what to do with them, and hopefully they'll be able to hire the right people, Godspeed. So to me, I feel very confident in supporting this for that reason as well. And then, to sort of buffer that on the other end, a commitment from the governor, who I have to commend for not only taking on this task, but also bringing this before this committee, and also for saying, that there's going to be a backup with budget requests and budget enhancements to ensure that these ongoing programs exist. I have to point out to all of those things because this is not just sort of a siloed, again, not a siloed approach to let's give another position and hope that it all works out. What I also have heard from the speakers this morning, I have to thank all of the really brave parents and the people who work with kids who are not only trying to face this by coming to this committee and giving their testimony, but have to deal with this on a daily basis where their hearts are breaking and where they're looking for solutions and there aren't any. If there is one thing that I think we have also heard, it is that this is an acute need. It is not something that can wait until the end of the legislative session in 2023, after we have figured out all of the other accounts and funded all of the other things here in the state. This is something that has to happen now. I also have heard, in sort of bolstering this and what has shed light, which hopefully will be something that is good because it has allowed us to address this issue. But the COVID pandemic has shed light on the fact that this is an ongoing problem and it's something that we need to address. And we have this solution before us that I really do think is very comprehensive. We cannot afford to wait. These parents who came and talked to us this morning cannot afford to wait. We have to be responsive to that. And these funds, these specific funds, these ARPA funds, are designed to deal with crises coming out of COVID. That is what they are designed to do. And that is what I believe these funds are doing. That does not mean that we are sort of only beholden to fund specific one-time requests when we have a commitment on the other end to ensure that as these programs work and as they continue to serve parents and as we are giving them solutions to help raise and grow their children and have their families intact, that we should ignore when we have folks who are willing to say, like the governor, we're going to put this in our budget. Unlike some of my colleagues, I can guarantee you, everyone in this room and everyone who is listening, I will be here next session. And I will be looking forward to supporting this and making sure that we continue these programs where we can home grow here in Nevada the right people for the jobs, where we can increase these types of programs. So we're addressing these needs with mental health professionals, but also with wraparound services and all the things that we've discussed today. That was a little lengthier than I had sort of intended, but I feel that there is where we would traditionally feel very uncomfortable about using a one-time fund for something that might be ongoing. I think in this particular circumstance, this is a very appropriate, necessary use of those funds, and I feel very comfortable with voting yes and saying that this is what we're going to do to give some solutions to parents who really need it, in the way that we should be acting as a legislative body, and my ongoing commitment to continue this conversation, to continue to invest in these and to continue to provide these kinds of services, because I will be here with all of you the next time around. Thank you, Mr. Chair.
Thank you, Senator Sotomayor.
Thank you, Mr. Chairman, for the opportunity to speak today. And this discussion has brought a lot of things to light that makes it a lot easier to consider voting on this bill. To me, we never should have shut down the schools as long as we did. I wish that we wouldn't have. It created a lot of problems throughout the system. And of course, that's why several people tried to actually introduce a special session just to intersect all those powers that were taken that put these decisions outside the reach of the parents and the people, rather than just being within one bureaucrat's control. But in that respect, you could double the amount of Highway Patrol people money right now, and you can't find them. So maybe in that respect, there's no real problem with voting to double the number of people or create new positions, because it's not going to create a budgetary hole, because I really don't think you're ever going to find them. Right now, you have a 20% vacancy rate. So in that respect, it gives me a little bit more comfort. And I also see within this ability, it'll create the situation where we can accept these funds and put them into budgetary accounts that might be able to be saved for later when we actually find more positions, because it sounds to me we actually need to grow these professionals in these fields, because we don't have enough, let alone in the state of Nevada, in the whole United States, as I see more and more problems that are being developed. So in that respect, I do appreciate all the information. Thank you, Mr. Chairman.
Thank you. Assemblyman Monroe Moreno.
Thank you, Mr. Chair. It's very encouraging to sit here today and go through this conversation. I want to applaud the people that are in this room today and the ones that aren't in the room that have been working with you all over the last year. It is so unusual to get a huge group of people to come together and say, we have a problem. A number of divisions did that, but not just say we have a problem, but work through a number of solutions to bring to us as a body with what those solutions can be to fix the problem. This didn't happen just because of COVID. We were in this situation long before COVID. And as my colleagues have said, COVID just put a microscope on what's going on. I haven't been here as long as some of my colleagues on the dais. I haven't been here for 24 years. I've been in this legislative body for 6 years. And in that 6 years, I've tried to change the way we as leaders look at the way we build our budgets, but also look at money that we've left on the table when it comes to federal funds, and changing our mindset of how we go about bringing that money to the state of Nevada to make sure that that money helps with the essential needs that make positive effects on our families. And I think what you've done is just that. We have this money that's here now. We have a responsibility to make sure that the money is not a one-time money, that we make the changes we need to do as leaders in this state to make sure that there won't be budget holes and that we aren't leaving families holding the bag at the end. You've done that. I applaud you on that. I thank you for taking those extra time, hours on weekends and nights to come to this, because I know it wasn't easy, but you're doing the right thing. And by us voting for it, saying that we hear what you're saying, we've heard what the families have said that called in, we've heard what the providers have said, the needs that they've had. And yes, we may not have the professionals here. We will have to grow those professionals. We will have to look at, as the chair says, every division and how we're paying them to make sure we're able to attract the staff that we need in every division, but especially when it comes to children's mental health in our state. So I thank you for the work that you've put in. I am proud to make this vote, and I will be back here next session and the session after that to make sure that the policies and the programs we put into effect now, that we grow and that they are successful. So thank you.
Thank you. Any other comments or questions? Yes. Assemblyman Peters.
Thank you so much, Chair. And I don't want to belabor the point, but having chaired Interim Health and Human Services this session, this interim cycle, I just want to reiterate how impressive it is that you've all come together to work on this issue. And in working with you and hearing from you in multiple ways, as we've discussed the needs of our children and the needs of mental health care and behavioral health care in the state of Nevada. I have full faith that following up this next session, we're going to be looking at how to successfully ensure that we have behavioral and mental health care out there for all people, that we have collaborative care models, that we have continuums of care that are accessible to all of the people in the state of Nevada. And I just want to express my thanks for all of you, really all of you in this room, even beyond the dais, for working together on this. And I look forward to, as Majority Leader said, working together this next session and being there as a part of this to ensure we have that full conversation and fully funded programs in the next session. Thank you, Chair.
Thank you. Senator Gocochea.
Thank you, Mr. Chair, and I'll be very brief. And to not support this would be ridiculous. I mean, we've got to put the money into it. We've got a huge issue in this state. We all understand that. I just want people to, kind of balance it out. It's going to take some time. It's not going to happen immediately. And I will be back next session as well. And I brought some bills last session, to facilitate healthcare providers coming to this state. It's more than just the money. We've got to grow the people. We've got to get them on the ground. We've got to get them trained. But how do you not support it? We have that need. Thank you.
Thank you. Yeah. Assemblyman Titus.
Thank you, and I appreciate the second time around here, Mr. Chair. And I know we have almost beat this to death, but I think it's worth the conversation. This is a big lift. These are many issues, as many people stated. And fortunately, I too will be back next year in a different seat, but I will be back. And I agree with the Senate Majority Leader that we'll be back here. We'll look at this in the governor's budget. We'll see where this money is. I am supportive of these programs. However, again, I need a commitment also from our Medicaid and other folks to make sure, and as Senator Gokachi just said, there are ways that we can improve access to care here. We have put in bills in the past to bring providers to the state, and they have been ignored. So again, we'll have this fight. We'll all be here to discuss this, because I think all of our hearts, everybody here has the right intention for the mental health of this state. How we get there is a different issue. So strong commitment I need from Medicaid to make sure that is resolved. Some of these issues have taken a long time to get here, all the efforts. So thank you, Mr. Chair, for the extra comment.
Thank you. Anyone else? Okay.
Mr. Chair?
Yes, go ahead.
Thank you. And not to add too much on to everyone else's comments, but this is a long time coming, and I know in conversations publicly and privately, we desperately need to do this. We do have a crisis, and particularly mental health across the board and with our youth. So I'm really grateful that for all the collaboration of all the professionals before us and all the testimony of families and advocacy groups that came forward. This is so desperately needed. And I do have a couple questions. I understand we'll get to some of those a little later on, some specifics, but I just want to make a comment in regards to just the distribution. We did hear a lot from, families across the state talking about the need. Of course, I heard from Washoe County families up in my district and the surrounding areas about the lack of needs. And then in the rural communities. And as I look at the list, I just want to mark that I do have a concern that we're making sure that these resources are really being spread out equitably to the entire state where the needs are. And I know we have some specific items for Southern Nevada, some specific items for Northern Nevada, and then China Springs in there. And then there's some general items for the departments as a whole across the whole state. And so I'd like to just continue that conversation to make sure we're really meeting the needs of all Nevadans across the state. Thank you.
Okay, thank you. I'm here. Anyone else wishing to make comments? Not hearing any. Okay, I'm going to take a motion here in just a second, and just a quick comment on my part. 18 years being here in the legislature, and every time we talk about mental health, we just say we don't have enough money, and that's really the only discussion. So the discussion that we've had today, and the people that we've heard with, are solutions that can work, and I'm glad that I got to hear that in this 18 years that I've been here. So thank you. So I'm going to ask my Vice Chair Carlton if she would make a motion.
Mr. Chairman, I would move that we approve the items that we've just been discussing, and once again, we're going to make a huge generational change for the children of the state. So I'm very proud, I'm very happy that this is happening before I'm forced into retirement. Thank you very much.
Thank you. And Senator Cannizzaro seconds. Just so I clarify, that's going to be items number 17 through 19, 31, 36 through 53. Any comments on the motion? Okay, all in favor say aye or raise your hand. Aye. Any opposed say nay. I'm not hearing any, so the vote is unanimous. Thank you very much. Thank you, all of you, for all the great work that you've done to be able to bring this forward. And I know that legislature we've heard some commitments here today that really want to work to make sure that not only can we start this, but that we can keep it going and make sure that we're doing the help that we need. So thank you very much. We are now going to take a 30-minute lunch break. I'm going to start a timer on my thing, and I'm right at a quarter till. I'm going to gavel back down. I do intend to take up items 55 through 57. First thing when we get back, which is the housing issues. So with that, we are in recess until 1:45. Okay, we're going to go ahead and get started, and we're back from the lunch recess. We are going to go to item number 55, 56, 57. Just a reminder, as we go, especially as we get into this afternoon, anybody giving presentations, try to make them as brief as possible. In many cases, I'm just going to ask that our members just go straight to questions. For the members, just asking you if it's something that you can get from staff later, then if I feel like that's something, I will ask you to do that so that we can just keep going, because we do really have a lot of items that we need to cover this afternoon and want to be able to be done before midnight. And so with that, if the people for this item, 55, 56, 57, if you'd come forward. I don't know if those, are you online? Is that my understanding? Steve A.
Yeah, hi, Senator Dennis. Good afternoon. Chair Dennis, Vice Chair Carlton, members of the committee. For the record, Steve A. Administrator of the Nevada Housing Division. Thank you for your time and consideration of the request of ARPA fiscal recovery funds to fund the extension of the CARES Housing Assistance Program and the Eviction Diversion Program. Since the onset of the pandemic, this division has been instrumental in providing conduit funding to allow rental assistance to be distributed to those in need. Combined funding from our partners in the state, from the ERA-1, ERA-2, and coronavirus relief funds, provided over $350 million in rental assistance. As of June 30th, all grantees in the state have expended 94% of ERA-1 funding, 51% of ERA-2 funding. As the ERA-1 funds will soon be exhausted, we anticipate an increase in the use of ERA-2 funds to support the balance of the program, but that support's only going to last for a limited time before it will be exhausted. The proposals here before you adds an additional $15 million for the use of rental assistance to ensure the program will continue for the balance of the calendar year, and the companion piece of $10 million to support an eviction diversion program. I will now turn it over to folks from Clark County to provide some more information on future expenditures.
Good afternoon, Mr. Chair and members of the committee. Tim Birch, Human Services Administrator for Clark County, Nevada. Just want to thank Steve and his team for all the great work we've done together over the last couple of months and years throughout this pandemic. Because of the partnerships with the state, we've been able to issue out over $300 million in rental assistance to families and households in Southern Nevada. That's over 65,000 households that have been able to stay housed because of the rental assistance that has come through Clark County. Specifically, the state was very helpful in sub-granting us $20 million out of the original CARES Act, $138 million out of the Emergency Rental Assistance, or the ERA Acts as well. It serves as emergency housing. In addition to the non-congregate shelter programs we've stood up, we have over 500 hotel motel units that we have families and households in any given night in Clark County. In addition to the $12 million of rapid rehousing programs called Operation Home that we're currently executing. So the programs before you would continue to help flush out that continuum and help remove some of the COVID-specific impact that the federal dollars have required in the past that were designated purely for rental assistance. This allows us to look at causes like fixed income, yet rising rents, and other types of issues that are causing people to begin to lose their housing. So we're here present, and Kevin Schiller.
For the record, Kevin Schiller, Deputy County Manager, Chair, Vice Chair, members of the committee. Just want to echo a couple things. The request that's before you, if you go back to the beginnings of COVID and you talk about CARES dollars as you transition through ERA 1 and ERA 2, I think you're all aware the Treasury guidance changed throughout that. So with that $300 million, there were kind of malleable pieces that were changing in terms of requirements. With those requirements, I think the other thing I wanted to echo, and I said it earlier in my earlier testimony, in terms of being the one-stop shop at the end, the reality is there are non-COVID eligible residents in conjunction with these same dollars. So from a social services perspective, to kind of echo what Mr. Birch is indicating, the eviction diversion specifically is really a direct collaboration with the courts in that process. So we are embedded with those courts. We're embedded with legal aid. We are essentially mediating. Eviction is kind of your last door in terms of how we intervene, but we also try to get to the front door. So we could probably talk for an hour and a half about what the new normal is. But when you start talking about 500 plus units of transitional emergency housing, those are for individuals where eviction diversion is not successful and or we have to house on that non-traditional homeless side. When we get into the use of these dollars, it's really trying to, how do we intervene on the eviction diversion side in the court, but also get upstream so that we keep people housed. I don't think you can answer that question without actually asking what happens, where do they go when they are evicted? The other component of that is we are working, we've dedicated $142 million towards affordable housing and workforce housing. We're in the process right now of finalizing those projects for awards. That is critical. You guys are aware of construction costs right now, but that will create capacity, which allows us to create that affordable continuum. So these dollars, as much as you look at them and say it's a Band-Aid in some perspective because we're trying to keep people housed, we have to keep people housed because if we don't, they're homeless. The second largest piece of that is how do we work on the fixed income, the seniors, those others. So it's in talking about this request and being very appreciative of your consideration of this request is absolutely at a critical need. And we started saying this about a year and a half or 2 years ago. The pandemic from the COVID perspective, you've kind of seen it do this. In our world, the human services pandemic has not peaked. So this request is really about a pandemic that has not peaked and we are still challenged with. I think we are 2 years out from seeing some level of flattening. It's starting to see a little more availability in rental units, but why I say this is critical infrastructure which we can get out the door to support clients and really echo the fact that these are families. There's seniors, there's families, there's your traditional homeless, your non-traditional homeless, but the reality is making these dollars go farther and the collaborative process with eviction diversion, I just want to echo that. I think you're going to hear more about this as you approach the session because we are looking forward to how do we engage social service so that we are not reacting, so we're being proactive. So I think that the crisis in a nutshell was an opportunity. I know it was horrible, but it also has created opportunity for us to change the system. So.
Thank you, Mr. Chairman, members of the committee. For the record, my name is Barbara Buckley. I'm the Executive Director of Legal Aid Center of Southern Nevada. We've been embedded working with Clark County on the eviction crisis since the beginning of the pandemic. We're here in strong support of these items. I also wanted to just mention how exciting it is to be implementing eviction diversion. You heard Judge Saragosa this morning. It's a game changer. And a couple of the pilot populations that I think, the plan is to work on, first of all, is the elderly, people with disabilities. With rising rents across the state and in Clark County, we have 80-year-olds on oxygen tanks getting an eviction notice. This allows us to divert them, to get somebody with aging and disability services that said they would be part of this diversion program, along with Clark County. We may pay the landlord 1 month of rent and then look for other options. It gives us time to come up with a solution that keeps the landlord paid and keeps the tenant housed. A win-win, instead of just throwing the 80-year-old out on the street and having them go to Catholic charities, right? It's a holistic solution that we're piloting, and we hope to bring you data and results next session, so it might be something that's considered as a statewide model. In the rural courts, a lot of the judges do this already, right? They're working things out between the partners. But in the larger jurisdictions, the volume, over 40,000 evictions a year, are a bit overwhelming. Having a program that's worked on by the courts, by the county, by the nonprofit partners, we can truly transform the state of folks becoming homeless when they shouldn't in the first place. With that, I'm happy to answer any questions.
Okay. Those are all the presentations, right? Okay. I'm going to go to Assemblyman Carlton.
Thank you very much, Mr. Chairman. And in interest of full disclosure, I partner with the county a lot as the Executive Director of the United Labor Agency. We have been a partner, and we're very appreciative of all the work that the county has done. So I come at this as kind of, it's like part of my daytime job, but that's the great thing about a citizens legislature. We all have those daytime jobs. The eviction diversion part of it, when people hear that, they're concerned that they're going to have to go to eviction court to be able to get assistance. So could you clarify that this is to keep them from going to court, is my understanding, so that we know how seniors totally overreact if they think they're going to have to go in front of a judge. So we want to be able to give them that level of comfort. So this is to be able to deal with that on the front end. And then the second part of my question is, Mr. Schiller said something about some affordable housing units coming online. If you could expand on that a little bit, when you think they might be online, what you're looking at. I know your guess is probably as good as anybody else's, but if you could just give us a little bit of where you think you might be as far as some of that affordable housing. The third part of my question is, with some of this new funding, we do have folks that have literally capped out on all the other assistance that's available for them. Will this start the clock new for them? Will they, if they've already used their 15 months of CHAP or whatever it is, and they're still in need until they can get into a more affordable unit, keeping in mind a lot of these folks, during the CHAP process, their rents went up because their leases came due. So you probably paid $1,200 one month and $1,500 for the next month. Will they have an opportunity to re-up their CHAP, or how will that actually work for them if we need to keep them stable through the transition? Thank you, Mr. Chairman.
Thank you, Mr. Chairman, through you to Assemblywoman Carlton. On the eviction diversion question first.
Could you identify yourself?
Barbara Buckley, for the record. The goal of eviction diversion is to keep the tenant out of court in the first place. It's going to be interesting to see how we can implement that. because Nevada summary eviction process is the strangest and most curious process in all of the United States. Instead of the landlord basically filing a complaint for eviction, the tenant must file first. You will be receiving a bill draft next session to reverse that process. I believe it may be supported by the landlords, the tenants, the courts. And then when the landlord serves a complaint, it can go right to diversion to keep a court appearance from ever being needed. It's going to be a little bit more difficult with our current process, but that is the goal because court scares people. So we're working on it.
Mr. Chair, through you to Vice Chair Tim Birch, for the record. Just to piggyback really quickly on the process, even with the process as disjointed as it can be now, we've been able to pilot at Clark County with all of the justice courts in Southern Nevada, a process by which once paperwork does get filed, prior to the individual having to come to court, social service gets a spreadsheet so we can reach out every morning and say, look, we know you just got a piece of paper on your door yesterday. Do you need help and how can we help you? And that process has led to about $42 million going directly into those specific cases. So we've been working this pilot before we actually sought pilot funding to make sure that we could really pull it off. So we have great confidence in that. On the affordable housing piece, the Board of County Commissioners, in addition to the wonderful allotment that you all have made to the cause of over $500 million, the Board of County Commissioners of Clark County put $142 million toward affordable housing development. That's in addition to our existing HUD affordable housing development we do on a regular year, where we have about 3 projects come online. We anticipate this to be able to double those up. So our goal is to have 2,000 more new units in the next few years. That is, of course, all things progressing along a development timeline and hoping that some of the backlogs in the supply chain ease up a bit. In regard to timelines, the third part of your question there, absolutely. These are new dollars without the handcuffs and restrictions. Those time limits were put on it by the funder, which were the federal government in those acts. These dollars are flexible and let us get in and look at a senior citizen's case to say, what can we do for you and how long? We might need to keep you housed where you are for 90 days. Pay your back rent, keep you here 90, and while we help you look for another unit. We right now today have about 22 families with voucher in hand who've been looking for over a month to find somewhere to accept that voucher. So long as we can help them with our housing harvesters, navigators, keep looking for places, keep them safe, keep them there. There's not a clock working against them in that vein until we can get them rehoused. And that's a part of our larger rapid rehousing initiative that I kind of blurted out earlier. We call it Operation Home. So we're really, again, trying to tie this into the existing continuum of programs that have really been demonstrated to work over the last 2 years.
Okay, thank you. Senator Neal, I believe, has a question.
Thank you, Chair Dennis. I just had a quick question on, so I'm trying to understand like the chat process, because I know somebody who, when you go through the chat process on the Clark County website, basically it still asks that question, were you affected by COVID-19? And if you say no, then it kicks you out and say you're not eligible. So are we flexing the chat requirements that are currently on the website in order to make this rental assistance combination work?
Tim Birch, for the record. The requirements are still present because the funding stream we're using is still the federally designated funding stream of ERA2 that has those rules. Once we expend those dollars, which we will be done here in the fall, we will change those requirements to reflect, and we're already working on the coding of the system to reflect the more flexible requirements of being on a fixed income, facing eviction due to higher rents, those types of questions and protocol.
And thank you for that, Mr. Burt, because what I'm hearing, because of the increase in rent, there are people who are seeking rental assistance because of now there's just higher rents, period, right? A 2-bedroom now might even be $1,800, $1,900, or $2,100, and they may have a higher income. Maybe they're at $50 they're at 50,000, but still with children and everything, they can't afford to pay that. And they're not eligible for the assistance. And so, you know, we've always had this issue of the mid-income folks who are being affected by, you know, gas and everything else, who are still in need to try to help themselves get into the door of an apartment and stabilize. And I'm wondering if you guys are looking at that population at all.
So for the record, Kevin Schiller, Deputy County Manager, through the chair, to you, Senator Neal. As you know, as we've talked, we have tons of people in emergency housing. And when we talk about that continuum, I kind of want to answer your question by talking about that. There's the COVID Treasury guidance, which kind of evolves between ERA 1, ERA 2, and that flexibility. But at the end of the day, I think your direct question is, what happens to that individual who's not eligible for these funds? So from a county perspective, we are the regional entity for social service. So whether we have ERA funds or whether we're using county general fund related to indigent dollars, that is our reset in our programming. So Mr. Birch can talk more about this if you'd like, but we also have a look-alike program that will come online, I believe, next month, which is specifically for that vulnerable client population. So we've dedicated about $3 million to start that so that we can actually fund those individuals that are somewhat falling in that category you're speaking to, which do not fall, they're falling in the gap. At the end of the day, that gap still ends up at our front door. So our normal and social service will never look like it did pre-COVID. So I want to make sure I make that clear. As you guys look to approve these dollars with these eligibility requirements, we still have a whole other set of programming and a new normal that we're revamping, utilizing dedicated dollars for restricted use, meaning indigent, homeless, those vulnerable populations. So I think you're going to see this evolution as you go into January and in the session and over the next year and a half. In fact, we're actually revamping our policies. We've been so reactive just in emergency housing. Getting to this issue of workforce training, all those pieces that tie into this is a critical component. But we recognize we have a huge group of ineligible clients that we still have to house at the end of the day. And where are they going now? So I'm going to answer that question. We're spending in upwards of $50 million right now just on emergency transitional housing. These are not apartments. These are hotels with services on site where I have to house them. So we have kind of moved from a sheltering component into a transitional emergency housing component. We get better outcomes out of that because you have individuals that are sitting in their own space, in their own rooms, and not in a congregate setting. But that is the challenge. And when I say that human services pandemic is yet to peak, that's the piece. And I think to your question specific to what's happening on affordable housing, you guys know this, the river is completely backed up. So what's happened is I can add another 300 units of emergency transitional housing, but then through Operation Home, we only have so many available units on any given day. I will say this though, we are seeing movement in those units. We've engaged all the landlords. So I kind of want to explain it that way so that you understand the dollars you're investing are part of a continuum, because without these dollars, those people are actually going to be added into that continuum and take away from that senior. So it's allowing us to take our general fund dollar and do that other non-COVID eligible client and get them housed.
Thank you, Chair.
All right, other Solomon Titus.
Thank you, Mr. Chair, for the question. I have several questions actually regarding how we got here. And I have some concerns that this is specifically for Clark County, and I'm wondering if this is a pilot program first and foremost, correct? I've heard you use the term pilot program.
Through you, Mr. Chair. Tim Birch, for the record, we have been piloting work with the court to early warning, alert us when people are first filed for eviction. We've not done that in the past. It's been a very, you have to come to us for assistance. And what we've found in working with the court system is less than 20% of individuals who receive an eviction notice actually turn up to fight it. So even fewer then go and ask for help. So this is a way for us to really be able to target individuals who don't know they're self-available in a new way. The pilot program specific to eviction diversion is really beginning to codify that with systems and coding and all the support services that are needed so we can move away from personnel-dependent processes into a more systemic approach.
Okay. And again, just for Clark County, so this won't affect the homeless or the evictions and anywhere else in the state of Nevada, strictly Clark County.
Our hope is that we do such a good job with this Clark County pilot that we come back to you and show you this is worthy of a statewide model.
And none of this money will go to the, does this money go directly to landlords, to the person who had a second home and then rented that second home? The people aren't paying, so now they've lost both their homes because they can't make their mortgage on either of their homes. Any landlord or homeowner assistance involved in any of this?
Yes, the timbers for the record, again, sorry, I keep following protocol. Again, the approach is we need to stabilize someone who's behind on rent because the likelihood you're going to go find an affordable unit tomorrow is slim to none. So in that stabilization process, paying the landlord and working with them, which we have done through the whole CHAP process, the past due rent, we verified on the day we issue the check, what do they owe up into today with late fees included, et cetera, and we pay that full amount to bring them whole and current. And then we will work with that tenant to say, if you can no longer afford to be here because you're on a fixed income, your rent's gone up, let's work with you to rehouse. So that could include down payment and moving assistance to another landlord, who could be a homeowner renting a second home, et cetera.
Right, so this could help the small, we're not talking always about the big owners of the apartment complexes. These could be just a small person who just has a second home that they rented and now they're in danger of that. And then I guess my final question is a concern about, there's an old expression about if you build it, they will come. And I'm just wondering if you have numbers of homeless that you had or people facing eviction pre-COVID, then COVID, because you made the comment, will never be the same. It'll never be back pre-COVID. But I'm wondering now so we had a pre-COVID numbers in Clark County of how many homeless you had or how many people got evicted. Then we have COVID when the governor shut our economy down, and then we had no work and people lost their homes. And now we have post-COVID where the jobs are plenty of job openings. So if you want to work, you can get a job. But now we can't afford the rent. And so now we have more people homeless now because of rent and expanding rent? Is that what we're seeing? Or do you have an increasing population in Clark County now? Has your population in Clark County gone down since pre-COVID, or is it dramatically up? My concern is that now you have more people moving to Clark County. They can't find a place to live. And so we're having these strange numbers of folks coming that I'd like to see better numbers on what we're actually looking at, pre, post, and during of what you had there established. And now do you have more people living in Clark County that can't find homes now? Because again, it's about supply and demand. I like the fact that you're doing maybe a public-private partnership of building more homes, affordable housing. I can accept that. It really is. Landowners are going to, or landlords are going to charge what they can get, right? So if there's no affordable or other apartments to rent, they're going to charge more. So now you have 1,000 people trying to find 100 homes versus you had 500 people trying to find 40 homes, however that math is. But I'm just curious about these numbers, and have we added to this problem is my concern.
Go ahead.
Mr. Chair, Barbara Buckley for the record. Just one comment, because our office sees 4,000 people being evicted every month. And in Clark County. And what we see is that as people began to get jobs back, the rising rents crush them. It's affecting seniors, it's affecting people with disabilities, it's affecting families. A family has to make $50,000 a year to afford the average cost of rent in Clark County. So if you're getting paid $12 an hour, you can't afford to rent. It's true in Reno too, right? And we're seeing it affect our children as they're starting out at that lower income level until they rise up. And it is a serious problem facing the state. The solution, you're right. One part of the solution is building more housing, right? And the governor's package, the county's package, your efforts are leading towards that pipeline beginning. But the need for these programs and for us to take an alternate approach to avoid homelessness for these individuals that can't afford the average rent, we have to prepare or we have another tsunami.
For the record, Kevin Schiller, Deputy County Manager, through the chair to you. I wanted to give you an example of something that I think is important. So the issue of, I'm just going to take families for a second. So earlier today, we were testifying around children's mental health, child welfare. Okay, the cost of child welfare when I open a case and I bring a child into the system, okay, is 30 times higher than me diverting that client and that family, if I can safely do it, in the context of housing. So 85% of the cases we see are neglect, but neglect by default is the family that Ms. Buckley just indicated, which is their rent's gone up, they're working, they're trying to pay their bills, and by default, they end up out of housing. I just want to echo when we talk about these dollars and where we're trying to support, one of the key pieces that I think is important is we're still seeing in the context of employability in Clark County, I'm just going to use the hospitality industry, in upwards of 30% of unemployment still. So that population is still there. But the second piece I wanted to highlight is we rented an entire hotel of 159 rooms off the top of my head. We filled it in 1 week. And we diverted almost 80% of those clients that were placed there by virtue of that placement, averted a default neglect sitting in DFS because we would have had to house the kids because they were in a park. And I say that because those dollars, if I have to do that, I will be here in January asking for dollars to support child welfare because that caseload, and then the outcome's way worse too. But to your point in the numbers, I completely agree with you. Is it worse? Because we've established rental assistance programming, my answer to that question is no, I don't think it's worse. I think the issue is the need with the rising rents and the convergence of the hurricane, as I call it, is kind of all over the place. Is there people that have abused rental assistance? The answer to that question is yes. Is there people that kick the can down the road? The answer to that question is yes. But overall, in terms of the deliverables, in terms of the Treasury guidance, the requirements, how we have to pay those bills, what we do, I will say Nevada has done a good job. We have stepped up and we have put that money into the community. I truly believe these dollars, and I say this kind of to your point, if we don't have these dollars and we phase out of rental assistance, if I was testifying before you 3 months from now, what I would be saying to you is we've shut this down and now I've had to go to the convention authority or I've had to go somewhere to set up a 500-bed emergency shelter because that's the only option that we will have. And so that I think one of the questions I want to make sure, or one of the answers I want to get to you is the case management behind that rental assistance is really what you're asking about. How do I divert them and get them back to sustainability so that we're not just putting the Band-Aid on and saying, okay, next. That's where you're going. And I think that's that continuum. We've been in reaction mode for 2.5 years. But we've actually evolved that. I mean, putting $300 million on the street is no easy feat, and I don't think there's perfection either. But I also think the case management side of this is really where you get your outcome. And I think we can provide those numbers. If these dollars are approved, we have to report on these dollars. So I think we can also say to you, here's where we've seen the success of this, and we can adjust accordingly.
So thank you all for that. And just as an aside, as a provider and seeing somebody in an emergency room to discharge them and not know that they had a place to go was critical because they'd just be back into our ER. So believe me, in the long run, I believe that it costs society less if we discharge them to a house. Make sure after discharge planning that you have a place to go. I understand all of that. I also want to make sure that there's some balance there, that it isn't just a revolving door, that folks no longer need to worry about rent because we are going to do it for them. So I, as a taxpayer, want to make sure that there's some accountability here and some successes and some reports, which is why I asked if this was a study. How are you going to document, has this made a difference? Or do you have just as number of people today as you will say in 2 years, or when you report back, seeking housing assistance without somewhere to kind of change where the direction of this train is going. So thank you.